Yes. Okay. Yep. You want a public comment? Yeah. Okay, let me get, I'll get a card for you.
Rebecca Sullivan. Hey, Ashley. Andre.
Sorry.
Over there. Yeah, are we all good? We are, yes. Alrighty, so it's 4 p.m. We're gonna go ahead and get this meeting started. Welcome everyone to the Desert Healthcare District board meeting of March 24th. And we go ahead and have a roll call, please.
Director Smith,
Here.
Director Rogers,
Here.
Director Presfield, can I join us this evening? Director Logston, Secretary Delara,
Here.
Vice President Rodriguez.
Here.
President Rafa.
Here, thank you. And now, next item, if you can please join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next item, C, approval of the agenda.
So moved.
Madam, I would like to make a change, please. I would like, for item J3B, if that item could be moved up to follow, grant number, section G, grant number 1599.
J3,
To J3D as in David, to follow item number G3 1499. I do have a conflict with that item, and that way they're all together. It can be gone until everything is addressed and then come back. Thank you.
we have a second, or is that a?
I will move that
Make it
forward.
official?
I'll second that.
Thank you.
Okay, all those in favor? Well, actually, do we need a roll call vote? If the items include,
Probably so, yes, since it's
can we go ahead and do that?
Director Smith. Yes. Director Rogers,
Yes.
Secretary Delara,
Yes.
Vice President Rodriguez.
Yeah.
President Rafa.
Yes. Thank you. Agenda's been approved with those amendments. Next item is D, public comment. At this time, comments from the audience may be made on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. The board has a policy of limiting speakers to no more than 3 minutes. The board cannot take action on items not listed in the agenda. Public input may be offered on agenda items when they come up for discussion and or action. Andrea, do we have any public comments at the moment?
We do, Director Catherine Sullivan. Please come to the podium.
Welcome. Can you please state your full name again?
Yes, Dr. Catherine Sullivan. And I'm here to speak on care coordination for the mentally ill. I'm a state of California licensed physical therapist. I've been on faculty at USC, and spend all my time in rehabilitation of people with brain injury, mental health conditions, after a stroke, Parkinson's disease, and to top it off, I have one that I inherited from my father. Nice guy, but whatever, he was a veteran, he was a wonderful guy, but it was in my family. And what I'm noticing now is that there is just not enough care coordination for the people who are severely mentally ill. So they end up being outsourced to the CV Mental Health Center, to the Urgent Care Mental Health Center, to, 5150. It doesn't matter if they're not connected. So I'm gonna meet with the staff at the health district, hopefully with the CEO, and look at some ways that we can save money by more effectively coordinating the care. And these will be for the people who are like Medi-Medi. It does include the homeless, but there's a lot of people who are Medi-Medi that aren't homeless. And the way we're treating them, they will be homeless. So we need to actually be a little bit more careful in how we place them. And so I'm suggesting coordination across silos, the silos of housing, healthcare, and workforce development. And I'm looking forward to working with you. And that's it. Thank you.
Thank you for your comments. Any other public comments?
No, I believe I have
Thank you.
done with the public.
And Director Loxton just joined us. Next item is the consent agenda.
I move approval.
Second.
We have a motion, a second. Can we please go ahead and have roll call?
Director Smith,
Yes.
Director Rogers,
Yes.
Director Lobson, Secretary Delara,
Yes.
Vice President Rodriguez.
Yes.
President Barraza.
Yes. Director Loxton, to you.
Yes, yes.
Thank you. Is item F, presentations, F1, summary of community listening sessions. Sophie, take it away.
Thank you so much. Hello, everybody. I hope everybody's well. It's good to see you. We have 30 minutes today, and we are here to present the highlights of the community engagement report. We want to thank everybody, first of all, because this is the output of a lot of effort from everybody's part, including the staff and the board. So this is everybody's work, and we're just very proud to share the results. So let's get started. I'm going to share my screen, and we're going to keep it short. Can everybody see that okay?
Yes.
Yes.
Okay, fabulous. Okay, so before we jump into the key findings, let's just remind ourselves of what we set out to do when we scheduled these community sessions. As you know, our goal was to capture the community needs through a mixed method approach to really achieve inclusivity and broad reach of everybody in the community. And we really had three goals. The first was to engage the Coachella Valley residents and partners in shaping the strategic plan that we've embarked on in the last few months to ensure that it really reflects the community needs, their priorities, and their lived experiences. That was the key goal. The second goal we had was to strengthen the alignment between what the community identifies as their key needs, as well as the district's goals and resources to make sure there was a strong alignment. And then finally, the objective was to generate actionable experience-based recommendations that we can implement in our next session, which is next week. So I'm going to hand it over to Angelica to take you through the highlights, and then I'll come back and talk about how we're going to use these insights and results and what our next steps are. Over to you, Angelica.
Wonderful. Yes, perfect. Thank you, Sophie.
Of course.
Hello, everyone. Again, can you hear me clearly?
Yes.
Wonderful. Okay. So, as a part of the community engagement report, we're going to present a summary of findings with 5 key insights from the entire process. And then we dig into some key themes within each of the 4 strategic pillars. that were presented to the community during our community sessions. But for the purpose of this conversation that we're going to have today, we're going to take a high-level overview of those 5 key insights. And as a part of this conversation, we encourage you to look thoughtfully at that final report of the full report, and then provide your feedback. We would love your suggestions. So let's dive in. Next slide, Sophie. Okay, so from across, from both the in-person and virtual sessions, participants consistently expressed their appreciation for the district creating this amazing space that we had within each zone and each region for every center that we connected with. Community voices were heard. We heard from multiple individuals. We heard from leaders and representatives. And over again, there was this consistent theme of thanking the district for hosting these conversations and inviting the input to impact the health of the Coachella Valley. The survey results reflected a similar sentiment, capturing broadly positive views about the potential of the work that's being completed for the strategic plan and over the next 5 years and beyond. While important challenges remain, there is a clear sense of optimism in this opportunity and the work that you all are doing. So with both the positive session feedback and the survey responses pointing to the fact that the community is highly engaged, they're appreciative and hopeful for the work that we're doing today. Next slide. And this is probably one of my favorite slides because it really highlights a lot of the work that we were able to do together over the past month and a half. And so we hosted in-person and virtual sessions along with implementing the survey. And across the in-person and virtual sessions, which had about 65 people, within that survey, we were able to capture the breadth and depth of the perspectives. We sought to encourage diverse cross-section across the Coachella Valley. We connected with longtime residents, community-based organizations, healthcare providers, advocates, public health leaders, public service leaders as well, with a broad range of lived experiences and roles within the region. At the bottom, you'll see that we highlighted some of those key groups that were represented as a part of the discussion. So I want us to really focus on these groups because we place some emphasis on those key partners within that report. For the in-person and virtual sessions, we engaged about 233 community members across 8 sessions, virtual and in-person, an average of 28 participants, with Coachella having the most participants out of all of the communities that we engaged. We had mayors, local city council members, and with the survey, we had a total of 224 responses, 184 in English, 39 in Spanish. And the most important thing that I want us to walk away from as it relates to this approach, we were very intentional about having a diverse group of voices that are shared with us. We wanted to be engaged and have everyone there to feel comfortable and open with sharing their perspectives. And we had this opportunity for people to be very candid with us and to feel safe within those environments. So kudos to us and the community for connecting with us. Next slide. As we are all aware, the Coachella Valley is incredibly diverse, and we made up many different communities and individuals with distinct identities, experiences, and needs, each facing unique and often differentiated challenges when it comes to health and well-being. Some of the community voices that were centered and highlighted over and over again within these discussions included under-resourced communities, youth communities aged 15 to 24, our senior communities, those who are age 65 and up, Spanish-speaking communities, and understanding that Spanish-speaking communities are not a monolith, they are diverse within themselves, and as well as the LGBTQ plus community. It is important that as we continue to have this discussion around the strategic plan, the mission is to serve all residents across the district at all stages of life. It is important that as we think about strategic priorities, we remain intentional about how decisions will impact these communities in particular. Ensuring that efforts are inclusive, equitable, and responsive to the diverse realities across the Coachella Valley. More details on these communities will be highlighted within the report. And now we get to the data. All right, next slide, Sophie. Okay, thank you. So, some of the key findings. I want you to keep in mind, we're just highlighting the top 5 key findings from the sessions, and there are more details that are highlighted within the report. The first one focuses on the current health systems and how they aren't meeting the needs of the community, and how the healthcare needs are very diverse across the Coachella Valley, but there are some consistent themes that came up within those discussions. So throughout the community engagement sessions and the survey, members of the community reinforced that the current health systems in the Coachella Valley, from traditional health care providers to programs that support the well-being of communities, are not adequately meeting the needs of residents and consistently contributing to delayed care, higher rates of preventable illness and disease, and increased reliance on emergency health systems. And we understand that emergency health systems tend to be strained. And we think about the context in which people are living, we know that relying on emergency health systems is not something that is sustainable. We also know that all of these factors can contribute to early and high mortality rates. When you look at the graphic here, and I think it is as large as it can get, across the board, we heard from the community that the response as it relates to the health system is not very well or somewhat neutral. Let's get to the next slide, and we'll go into some details about that. Some key factors that contribute to this overall view around the health systems across the Coachella Valley is first as it relates to the workforce shortages. The workforce shortages are a system-wide barrier to accessing consistent, high-quality care. The key words that I really want you to focus on here are consistent and high quality care. Residents across the Coachella Valley describe difficulty accessing care in a timely manner due to provider shortages, limited specialists, and high turnover among healthcare providers. These challenges often result in long wait times, short appointments, difficulty building trusted relationships and a connection with the doctor, which we know sustained care, having those relationships can lead to improved health status for so many. And then there's this major difficulty around trust, and then the lack of culturally competent or culturally empathetic providers who reflect or understand the communities that they serve. Survey responses reinforces this finding, with provider shortages identified as the most significant access barrier, followed by the wait times. And what I remember from having some discussions within the community sessions, that this came up very often, but it also represented fragmentation within the systems. And I know some of that has been highlighted already. The comment earlier was very, very timely, and it's reflected within this report. All right, next slide. All right, we know that I love talking about the social determinants of health, and this turned out to be a major theme in almost every single community session that we had. And it was highlighted within the survey. So for those of you who are not familiar with the social determinants of health, the way that we talk about it is all of those contextual factors that influence your life before you get to a doctor. We love this quote from one of the surveys, and it said that addressing food access, environmental heat exposure, transportation barriers, and care navigation together would have a greater long-term impact than just expanding clinical services. One thing that I really want us to keep in mind is that there are opportunities for the district to partner with so many different organizations and leaders, and we'll talk about that in a little bit. So residents consistently emphasize that health is shaped by more than medical care alone. Issues such as housing stability, food access, transportation, environmental conditions, and social connection were repeatedly identified as critical factors influencing the health and well-being of individuals and families across the Coachella Valley. Let's go to the next slide. And within that slide, we're going to highlight which topics in particular, as it relates to the social determinants of health and a connection to health outcomes, that were discussed from community members within the sessions and within the survey. So number 4 focuses on awareness, navigation, and access gaps that prevent residents from fully benefiting from existing health services and resources. And when we think about this, it is those nuances of the social determinants of health, along with their actual experiences with a health provider. So community participants frequently shared that while many services exist in the Coachella Valley, residents often struggle to find them. And sometimes it isn't just that new services and resources need to be created. Sometimes we're in a situation where people don't even know what resources are available to them. And when they find out the information, they don't know how to navigate the systems that are connected to that resource. And then last but not least, they may not be able to access it in a way that is sustainable for them. Will it be finances, insurance, language barriers, cultural connection, transportation, so on and so forth. Language barriers, limited digital access, and the absence of centralized information were some of the top factors that made it difficult for so many members of the community to engage their health services. When asked about the largest health and wellness challenges their communities face, over 50% of survey respondents selected access to care. And again, that is focused on finding, scheduling, and reaching care, as well as the availability of healthcare providers being a top concern. So the social determinants of health, again, centers around a lot of these factors. If you can't get there, or you can't pay for it, or you can't access it in a meaningful way and sustainable way for you, it becomes more difficult. All right, last but not least, next slide. Number 5 focuses on better coordination, data sharing, and collaboration across organizations that are needed to reduce fragmentation and improve collective impact. Over and over again, we heard that there is a need to bring people together, bring the systems together, find a way for the systems to talk to each other. Community members highlighted that many organizations are working hard to support residents, but efforts are often fragmented and difficult to navigate. Participants expressed a strong desire for stronger partnerships, shared information systems, and more coordinated approaches to ensure services reach those who need them the most. We also heard that the district has the opportunity to leverage those partnerships. And within the report, we highlighted some of those suggestions that came from the community about key partnerships that could uplift opportunities that we will and recommendations that will be highlighted within the strategic plan and at the end of all of our work together. One of the largest suggestions, overwhelming suggestions that we received was collaboration with local and state governments, as well as funders, and then the power of the district being a convener of smaller organizations. Over and over again, as a part of the community sessions, we saw people connecting. So that work has already begun, and we know for a fact that you've been doing this long before these community sessions. But within the conversations that we've had over the past month and a half, there were people who were asking questions about and sharing some of their concerns and asking questions about services, and other people would be in the room and say, hey, we do that very well, take my card, or hey, I want to learn about this too, can we connect when you find a resource, or if I find it before you do, I'll share it with you. The power of being a convener and getting people into one space and bringing those systems together, we saw the impact early on, and that is something that the district can continue to do. See, I got really excited about that. Now, I'm going to pass it back over to Sophie, because given all of the recommendations, all of the key highlights that we have here, we're going to outline some actionable recommendations that can come from these 5 key highlights and the information that's highlighted in the report. Back to you, Sophie.
Thank you so much, Angelica. So as Angelica said, this is just the surface, the highlights. We really encourage you to read the entire report. It is really worth reading, and there's a lot in there. And what I'm going to talk about is also very high level. What can we do with these highlights as we go into our next session together? And the first thing is that we need to keep in mind that we have this great basis as a community partner. a trusted community partner, as Angelica said, which is going to be key to becoming the amplifier that we aspire to be. However, we should also keep in mind that the brand recognition is pretty low in the community, and you deserve way more recognition and a lot more communication efforts around the wonderful work that you're already doing. So that's one thing we should keep in mind. I think one of the things that everybody should feel confident in is that the true north that we presented for the organization to the community and the 4 strategic pillars that support that true north were widely accepted and clearly reflect the key needs of this community. So I think that we are in a great position to create maximum impact. Angelica already touched on this, but including the social determinants of health in the development and the implementation of the new strategy is going to be vital in order to really deliver on reflecting the community's need in our work. As Angelica said, as we go through this, we need to, at every point, think about what are the potential partnership opportunities to bring this strategic plan to life. Because there are many that are available and they need to be pursued with intentionality and consistency. They must really drive our goals and our objectives. Another thing is reflecting the impact of the work, and this is tied to the brand recognition, but reflecting the impact of the work, both qualitatively and quantitatively, is really critical to the community. They want to know the good work that you're doing. They want to see the progress. So as we talk about data maturity, as we talk about the use of data, we should always keep in mind that one of the key goals is reflecting the impact back to the community. As Angelica said, as we develop the strategic plan, the final version, we should really, really keep in mind those key spotlighted communities as a reminder that it is a very diverse community and that it needs to meet everybody's needs. And the last thing that we need to keep in mind is ways to continue this wonderful process that has begun of regularly integrating the community's voice, not just, at certain points, because it is not only welcome by community and partner members, but it's also, expected. Okay, so we're keeping to our time. This is very brief. As you know us by now. We're super excited. We could go on for about an hour, and we're really excited to come and see you next week so we could talk more about it. But that's where we'll stay for now. Let me just take you through very quickly the next steps just to ground everybody. So this delivery of the community report basically finishes our community engagement phase, which is number 3. And we are on Monday going to start our strategic planning version number 2. And what we're going to do then is we're going to come to you having triangulated all of the data that we have, the community sessions, the survey, the prioritization exercise that you did, and we are going to review how that impacts the key initiatives. And then we're going to review what we're calling the tactics toolbox, how we can implement that over the next 5 years. Any questions? Any thoughts? Any feelings about this presentation?
And do you have any feedback about the community sessions on how those things went as well? We would love to hear if you had any additional feedback.
Thank you. Director De Lara does have a question.
I'm sure others will follow, so I'll start it off. Okay, first of all, there was one error that I noticed on the engagement participants. I attended all the sessions. I had to leave early on one of them. You actually included that the mayors of La Quinta and Coachella attended. Only the mayor of La Quinta attended and elected officials at Coachella attended. So if you could make that correction. The next part of it being, I think that all of the surveys are good information for us to use. I hope that, I know we're also including other documents to give us a more comprehensive analysis of our community, which I think it's great because even though we had a very good turnout of 233 members, that's a very small representation of our community. I am glad that we went all over and that we offered the sessions at different times of the day, different, weekdays and weekends. But it is a very small representation. So just acknowledging that, that we could do better on that front. And also the work that staff has done about the stakeholders that are involved. Let's see, one of the things that I noticed was that there was the request for more sessions. That was a 43.75 rating. And I know we can't continue to do this, but I think what we have all committed to is to transition to, instead of doing this kind of an effort, that we will continue to engage, look for other opportunities to engage with our community. And I think that's just acknowledging the fact that there's still, like you said, that a lot of our residents don't know who or what we do. So that is a necessary part of the next steps forward, is how do we continue to engage? And the last thing is what you mentioned, Sophie, at the end about the use of data and how important that is to be able to report back to our community as how we are doing. And I think that is essential, that we recognize, being able to assess and evaluate. And I think that's something that I just want to bring up right now, because I think this is a topic that I want to address later on in the meeting. But the importance of that. So thank you for.
Thank you. Any other board member comments? We'll go ahead and open up for public comment. If there's anyone.
This is Dr. Sullivan, and so thank you for your recognition of the topics I was bringing up. And you guys have done a fabulous job, because you're seeing the same thing I'm seeing. I'm actually coming from the perspective of people who are living the social term as PALs. So trying to figure out how to access areas that are severely underserved. Like Desert Hot Springs, North Palm Springs, east of Indio, Blythe, these areas. And so I'm going to be coming to the Desert Health District at the end of the month, just talk about how we can use telehealth and use different strategies, monitoring devices that might let us reach out into the community, but have local community trained, be able to respond appropriately. Right now, I don't see that. I see lack of training is probably one of the biggest problems. And I've had to, last week, talk to a psych tech who has less than a bachelor's degree, tell me with a PhD what's supposed to be happening to her mental health patient. And I'm like, no, we're supposed to be data sharing. So I'm trying to share with you my observations about medication management. And she's like, who are you? Like, you know what I mean? Some of those things have to be clarified about what the different roles are of the different professionals in the hierarchy of health. But thank you, you guys did a great job. Pretty much, I agree with everything you said.
Thank you so much. Thank you.
Thank you for those comments, and Team Soin, we'll see you next week.
Thank you,
Thank
everybody.
you. All right, bye-bye.
Bye.
Well, I guess I didn't check if there were any other public comment. No, maybe. Okay. Okay, so we're gonna go ahead and move on to item G, strategic grant funding. For this, if there's no opposition from the board, I would like to hear maybe an intro from staff members, including the recommendation on the grant. Then if we can hear from the applicants, board member comments, and then open for public comments on each individual grant. I don't know if that's okay with the board, that process. Okay. And then we, if you do want to speak on one of these items, please fill out a speaking card or give your name to Andrea so that we can do it in an orderly fashion. So let's go ahead and get started. G1, grant 1560, Live to Rights, Rising to the Moment, Elevating Our Region's Voice for Economic Protection.
Okay, so you have your staff report in front of you with a copy of the application. Brought forward to the program committee with the staff's recommendation to decline this grant for the following reasons that are listed in the staff report, and with also the recommendation, from staff that to follow the strategic plans we're going forward 2026 to 31, in particular, pillar 3 with this particular, grant request. So the program committee is recommending to find this grant.
Do we have anybody from the organization that would like to speak? Okay. Board member comments, questions? Go ahead, Director Rogers.
Well, I would just like to point out that the number one problem, according to the data, in the people who live in the Coachella Valley is food insecurity, often driven by a lack of affordable housing and high living costs. And I know that staff and board members on the program committee have stated that this application for a grant does not match our current priorities for healthcare goals. But I think that that we can revisit that and relook at that, because we know that Lift to Rise does a fantastic job in elevating the availability of affordable housing, and the process that they are using right now is so effective. I've attended their monthly meetings and follow them. The other point that I want to make is that the same point that I made at the last meeting, this organization is sitting on $5,951,707 in reserves. And our budget shows we have $1,263,815 over budget. And I just think that it looks like to the public that we're not paying attention to the needs of the community. And I strongly recommend that we fund Lift to Rise. I make a motion that we fund Lift to Rise for $400,000.
Any other board member comments?
Yeah, so, the board decided, I think it was at the last board meeting, that we weren't gonna do any more grants if they did not meet the high priority pillars. And that was a lot of the discussion in the program committee, is to respect that decision made by the board. Additionally, while we may have some reserves, we also made a decision as a board to allocate a certain amount of those reserves. I am one of the biggest fans of Lift to Rise, as you know. I've been involved with them since their very inception. But unfortunately, this grant request did not meet those high priority pillars. There's nothing in this grant about building housing. It's more about communication aspect, which I agree with. But again, I think it goes back to the discussion we had in the program committee, that we really feel this would be a better opportunity for them to apply after we complete our strategic plan.
Thank you for those comments. Any other board member comments? No. So we currently have a motion. Is there a second? Director Rogers, would you?
I'll withdraw my motion.
Okay, motion withdrawn.
So I would move to take this recommendation from the program committee to decline the application, regrettably.
I will second the regrettably part as well.
Okay, thank you. Any public comments on this item?
No public comments.
All righty, roll call, please.
Director Smith,
Yes.
Director Rogers,
No.
Director Longston,
Yes.
Director Delara,
Yes.
Vice President Rodriguez.
Yes.
President Barraza.
Yes. Thank you. Next item.
Can I make a question on that item? I just wanna, I want to applaud Director Rogers's comments on her support of Lift to Rise, the recognition that you have given them on the role that they have played to elevate the need for affordable housing, and the fact that you participate in other meetings and really are an advocate for everything that they stand for. So I just want to applaud your efforts.
Thank you.
And congratulations, both Director Rogers and Rodriguez on receiving that award. Okay, so, Director Smith,
Yes, thank you for, let's see, this is item G2. Grant number 1526, I will be recusing myself. Item, as well as, number 7, G7.
okay,
G2 and G7.
So I'm also going to be recusing myself for the following grants. Grant number 1526, grant number 1499, and the one that we moved up.
which is item J3D.
So I will.
I'll also be recusing myself on that one.
Okay, we'll let you know when we're ready to have you back. So next item is G2, grant number 1526, Regional Access Project Foundation, Coachella Valley Health Living.
So once again, this was brought forward to the program committee, and in your staff report, there's the background and the reasons for staff recommendation to decline this grant as well, with the opportunity to find when we have our new strategic plan in place with pillar 3, and program committee moved to recommend to decline the grant as one of the
Do we have representation from RAP that would like to speak on the item?
There's someone online, but I'm not sure if they. Oh my God. Here we go.
No, we
Please
don't
announce.
say at this time.
I'm sorry, would you like to make a comment?
No.
Thank you. Any board member comments, questions?
I have a question. I know that the board or the staff works closely with RAP Foundation in terms of their support for the NPO program. Could you give a one paragraph description of how our district staff works with their organization?
Actually, there's an item that is coming up right after the intercare grant. That's the partnership of capacity building. We moved it up.
Got it. Okay.
And we're getting a presentation from.
I make a motion to approve grant 1526.
To approve the recommendation to decline?
Approve the recommendation to fund it.
It was to decline. The program committee recommended to decline the application, because again, it doesn't meet the priority.
Our
program.
priorities.
I make a motion to decline.
Second,
Public comment,
No public comment.
roll call, please.
Director Rogers,
Approved, yes.
Director Longston,
Yes.
Vice President Rodriguez.
yes.
President Barraza.
Yes. Thank you. Did Director Smith say she would be recusing from the next item
Yes.
or just J?
Not from intercare,
Okay,
just NPO centric, so may need to bring her back for this one.
Oh, I thought she said she wanted to recuse herself. Text.
Go get. Or if you want to reverse the order and do NPO centric, we can do that.
Yes.
Yeah, let's do
And-
that.
alrighty, so let's go ahead and move to item J3D. There'll be the same process, intro from staff. Time for the applicant to provide comments and then board member.
Which grant number is that? I'm sorry.
It's J3D.
We moved
It's not a
it.
grant.
Oh, I missed the part about moving it up. I got it. Okay, sorry.
So as an introduction, in your staff report, we've outlined the background of the history that we've had, a very successful partnership with NPO Centric in helping to build organizational capacity for our grantees. The partnership is coming to, and this current one is the end of this month, so this is the opportunity to renew it for 2 more years, not to exceed $420,000. $100,000. And Callie, who's the executive director of Director of MP Extension, just as a short presentation, just to kind of highlight the past accomplishments from the last partnership.
Thank you. Good afternoon, everyone. My name is Tally Fantini. I'm here to talk about the partnership we've had with the Desert Healthcare District, a little bit about MPO Centric, and a little bit about the proposal that's on the table today. So we are the capacity building arm of the Regional Access Project Foundation. We have been in existence since 2016, our program, and we work with nonprofits throughout the Coachella Valley, building capacity as well as sustainability for nonprofits. We have most recently also been expanding throughout the Inland Empire in Southern California. Next slide, please. Some of the things that we do, we have capacity building program, which also includes a membership program. And some of the membership benefits are discounts on our professional development and training. We have a professional certificate in nonprofit management. We also facilitate Desert Fast Pitch, which is an annual competition and opportunity for training for nonprofits to learn how to pitch and grow as a nonprofit in terms of sharing the impact of their work with the greater community. We have networking opportunities, and we do a lot of marketing and branding and visibility, as well as our technical assistance grants, where we pair nonprofits with consultants to work on specific projects like organizational assessments, strategic planning, fund development planning, board governance, and things of that nature. Next slide. It's the partnership. It's specialized support for Desert Healthcare District grantees. It's been called the Long-Term Collaborative since we've been in partnership with the Desert Healthcare District since 2022. And part of it is giving memberships to those grantees that work with us and getting them, of course, aligned so that they can be sustainable and grow as a nonprofit. Sometimes that happens before they start working with the Desert Healthcare District. Sometimes it's during, sometimes it's after, sometimes it's more than once. If we find that we start on a certain project and through that project, we learn that the organization needs more help in the fund development area, or perhaps their board needs some training, things like that, then we'll go back and do a second project. Next slide. Again, just talking a little bit about the different areas that we work with the district and their grantees in terms of governance, peer-to-peer learning, fund development, and evaluation. Next slide. This is a list of some of the organizations that we've partnered with over the last few years. All of those projects that we work on with the Desert Healthcare District, those documents, strategic plans, organizational assessments, whatever, those all get forwarded to the programs team so that they can evaluate the organizations that are applying for funding. Some of the impact, we shared some testimonials. Again, just there's a lot of testimonials that came out of our final reporting and our mid-reporting, but we just shared some of the highlights. I'll say Martha's Village and Kitchen realized positive outcomes with the assistance of capacity building support extended by the Desert Healthcare District and MPO Centric. The assistance was helpful in strengthening our capabilities in planning, grant research, and financial management. And so that was just one of our testimonials. Next slide. So the next iteration, Donna and I have been meeting with her team and our team talking about, what does this partnership look like long term? How can we consistently continue to provide this support for the nonprofits in our community? And some things that came out of those conversations were that we don't share enough publicly about the great work that we've been doing in this partnership. So as we looked to the future of what this partnership could look like, one of the things that we agreed on that we really wanted to do was really leverage the impact that we've had with a lot of the nonprofits. And what that looks like is bigger marketing, more communications about the work we've been doing, some branding about the work that we've been doing, doing some storytelling, and really just letting people know that the healthcare district has been involved in this work because we really haven't been marketing it. So it's something we want to do as part of the next plan. Next slide. So these are some of the components of the plan, co-branded collateral, content creation, digital marketing, newsletter articles. Some of it will be organic and some of it we will have to work to build. Next slide. Another part of the expanded partnership, which is a 2-year expansion, will be some workshops. So a lot of what we do at MPO Centric is a lot of professional development and a lot of workshops for nonprofits. So we're going to partner on some of those to get some information to the nonprofits, more information about diversifying funding, learning how to build a pipeline, and a lot of other things that we're going to partner on in our workshops. So ultimately, it's a 2-year extension. It's really just to continue to support the nonprofits in the Coachella Valley like we've been doing. MPO Centric does that. Now we also do that with the Desert Healthcare District, with the Desert Healthcare District grantees. We want to continue to develop these nonprofits. We want to give them the tools they need to be sustainable. We've had a lot of success over the last 2 or 3 years that we've been working, so we just want to continue to be able to do the great work. And that's the end of our presentation. I will say that I thought it was really poignant that in the presentation from your strategic planning team that they highlighted some of the things that Donna and I in fact talked about even before the listening sessions, which is communication and the brand recognition that we also think that the Desert Healthcare District and MPO Centric should do as a partnership. And then reflecting the impact back to the community, which is something that came up. We feel really strongly about that too. Like I said, we really haven't been marketing the partnership that much. So really to get the story out there about the great work we've been doing, we want to do. I will say that I do appreciate staff's recommendations. Staff did make a recommendation for our original proposal. We had submitted, as it says in the notes, an updated proposal because our board was looking for an investment at the beginning of the 2-year expansion for some of those marketing efforts that we've talked about. So I did just want to share that on behalf of the rep board, that's something that they were hoping we would consider.
Thank you. Thank you for the presentation. Any questions?
Thank you.
I don't have any questions. I'll just make a couple comments.
Yeah, I was gonna do it too. Go ahead.
Yeah. I've known a few organizations that have utilized the services and it's invaluable, especially those newer ones that don't have technical capability or even a knowledge of what an audit is or how to apply for grants. So I think it's a really valuable partnership. It also goes off to the point that was made about really expanding not only our brand, but really our outreach into the community, letting the community know what we do in other aspects of the districts.
Great. Director Luxon?
You have something you want to say, Carol?
Oh, I just wanted to say personally that I've been acquainted with some of the organizations that have taken some of the NPO classes. And one in particular was so excited about the fact that they were finally able to figure out what their mission was and what their North Star was. And it really gave the organization a lot of clarity.
My comments will echo Greg's. I wasn't as familiar with NPO Centric, but I've been talking to staff and I guess the review process they do has really added a lot of capacity to the board, which is the questions that came up in our finance committee, and Donna was able to answer a lot of those, that they really do add a lot of capacity to the board's capability to continue to vet and screen and to assist the nonprofits we support, which I think is, like you said, Greg, it's invaluable to the community to really help actually build these organizations up. We know it can be very challenging to do with limited resources that these people support.
I'll entertain a motion.
Excuse me, we should have a public comment before the director's vote.
You can have a motion though.
Yeah, but we were going
Go
to
ahead.
go. Yeah, thank you though.
I'll make a motion to approve it.
I'll second.
Alrighty, now, anybody that would like to give,
Councilmember Pai, please take the podium.
My name is Jan Pai. I'm a rep, board member, and chair of the NPO Centric Committee. I am here to support this proposal and also as a resident of Desert Hot Springs. I attended the community engagement meeting hosted by the district on February 7th. Heard in the comments and presented today that capacity building is important for nonprofits serving all of our residents. I am in favor of this proposal with district and NPO partnering. Thank you.
Thank you, Jen.
Any other public comment? No others, no. Alrighty. Then, roll call, please.
Director Rogers,
Yes.
Director Logston,
Yes.
Vice President Rodriguez.
Yes.
President Paraz.
Yes. Thank you. Then, can we go ahead and get Director Smith?
No, I sent her a text. She didn't answer.
No, Director.
It's also for.
Welcome back. Next item is G3, grant number 1499, Clínicas de Salud del Pueblo, DBI Intercare, a Coachella Valley Teaching Health Center program to address primary care physician shortage.
So this is one that was brought forward to the program committee. Report gives a lot of information about the grant, and the program committee is recommending forwarding to the board for consideration to period of $2,975,625.
Do we have any representation from the organization that would like to provide any comments?
They're here.
Welcome.
Thank you so much. And I'm not alone tonight. So I will introduce you to Dr. Hannah Leimer. She's our program director for the Family Medicine Residency Program. And again, it's my pleasure to be here. My name is Conrado Barza, the designated institutional official for Intercare. And there's a few things that have happened tonight that I want to highlight. The first one is Director Rogers, thank you for the comment that you made about housing. We see how an affordable and stable housing really has an impact on the physical health and the mental health of the people we serve at Intercare, and leading to food insecurity, to mental health issues, to anxiety, depression, and addiction. So thank you for making those comments tonight. Another thing to highlight was the conversation about the strategic planning and how the Desert Healthcare District, again, is elevated as a community healthcare amplifier. And we hope to work together over the next few years to make this investment in workforce an exemplary program for our community. Workforce shortage was highlighted as a system-wide barrier to consistent access and quality of care. The lack of culturally competent physicians is something that is impacting our community. And these are the things that we're addressing through the residency program that we are building. This is a leverage collaborative effort, bringing together federal, state, philanthropic, and institutional resources to our community. Your investment serves as catalytic support to move this program from planning to implementation. And a key example of this collaboration is that the residents will be placed both in Intercare and DAP Health, the pivotal city. So this will have effectively being creating an infrastructure for regions in the east and the central part of the Coachella Valley. So again, I want to highlight we are an ACGME accredited sponsoring institution. We have submitted the application for accreditation, and the impact is long-term and proven. Physicians tend to stay where they train, and by training residents, locally, we hope that we are going to build that infrastructure and build the stations that we need. Thank you for your consideration. We're happy to answer questions.
Thank you. Any board member?
I just had a question. Are you accredited? Did you mention you were accredited?
Yes.
You are. You haven't, it's already approved.
The program or the,
I just want to clarify,
The sponsoring institution, yes,
but not the program, right?
not the program. We
Okay,
submitted
I just
the
want to make sure we separate that because it is a little confusing.
Thank you.
Any other board member comments? Questions?
Yeah, I had a few questions. One of them is that some of the comments from the reviewers were that number one, that the program or the grant application was a 3-year grant and there were deliverables or contingencies that were part of that. So I'm just wondering, in the fully executed contract, are those contingencies listed? For instance, fully executed affiliation agreements, operational details, tracking system, are those all part of the final agreement?
We hope so.
Yes, and if you look at Exhibit B, which is Exhibit B that does list those,
I've got
the contingencies.
See it.
Page 41. 45. The fees, the payment is the payment schedule requirements and delivery.
The last page.
So just for
packet.
you mean the grant contract? Yes, it's the whole packet, yes. Yeah. But Exhibit B is with one.
Director Gargis is.
I found it.
Okay.
So will, legal counsel will review, and is that a year program?
Yes.
Review it if years?
Yeah, we've looked at it and we just, these are sort of goalposts that have to be reached as we go through the funding process, and it's reimbursable. So I think everything's in order, Director Rogers.
One of my concerns is that the operational agreement with Eisenhower, would that be part of the?
That's coming out.
Yeah.
That'll be, they'll share that with us.
Any other comments, questions?
Yeah.
Director Rodriguez?
I'll just make a comment and I want to congratulate both staff, Chris and Donna specifically, and Intercare, the whole team, because this has been over a year-long process now. And there were some real questions in the beginning about timelines and program director, and welcome. But I think there's been a really good back and forth. And as we saw in the presentation, and as we know, the workforce supply is the #1 issue when it comes to delivering healthcare. And I know it's an issue for Desert Regional, it's an issue for Eisenhower. And I just think this is a really good complementing factor in utilizing 2 really high quality healthcare providers in the Valley to carry this out. So with that, I would move adoption of approval of the grant.
I have a couple comments, mostly around kind of what stimulated the original reevaluation. Is more or less the capability of taking residents and being able to produce a final product that not just stays, but is a capable trainee, and that we can deliver the case volume that they need to make sure they have the reps with patients to be able to develop that. You know, the match, we all follow the match results, and I think the match results came out Friday, and I'm always looking at how Eisenhower does. And so I pulled up some results. I think Chris actually shared them as well today, but you know, I do have concerns just because, and maybe Desert Regional will speak to it, but Eisenhower had trouble matching this year. Desert Regional matched 0 family medicine through the match. That just tells me that, you know, we're opening another program, and my concerns are still there that I voiced from the beginning. And as the only person who's been through this that's on the board, you know, my job is just to advise about what I see and observe in the community. And found him. Yeah, so I just have a lot of concerns about the ability to maintain and fill the quota. I mean, I think Dr. Lamer went through family medicine residents. You've been out here a while, you know, and taking care of patients and doing a great job. I mean, it is a big deal to make sure that you fulfill that commitment in terms of training so that they come out and they're capable. And when I look at the numbers, and again, I just see that there was no family medicine spots filled this year. And I go back to my original concern is, can we actually do this? Or should we go back to the drawing board a little bit, not far, partnership, but look at how the board really wants to participate in this? Because, you know, unless you understand how to read, yeah, there's Eisenhower's numbers too. See, they didn't match 5 people in family medicine. And now we're adding additional spots out here that currently aren't being filled for the initial match. And so what typically can happen is they can scramble at the end and try to fill in spots. But when you match 0 people, that means the people that interviewed and who you ranked didn't line up at all. And I have a lot of concern about that you're going to open up more spots out here. And so there's limited amount of patients to train. I worry that residents are going to leave if they come here and they're going to transfer out. Excuse me. That happens from time to time. I had friends that had to do the same thing when their programs closed. And it's very disruptive to somebody who's taken out 300,000 or more in debt, signed on to, you know, this isn't like the NIL where you can just bounce teams. You can't do that anymore. It's not getting paid. You have to stick when they sign that commitment to you, they're there. And so I think we really have to understand as a board that you're taking highly trained professionals, you are entrusting them here. And the current data from this year in the Coachella Valley says that we cannot match family medicine residents currently in 2 very large programs here. And now you're adding a 3rd. And it's not a no from me initially. It is, we have to be very careful what you're offering, what you're putting out here and what you're funding. And so that's, I mean, you can't answer these questions because this isn't your program. But, you know, if you look at the data that's coming, there it is. I mean, the prior years, they had no issues with filling. And now, like I said, I have concerns about it based on everything I'm observing in the community. You have declining numbers. So.
I could speak.
Oh,
to that a
please,
little bit.
yeah.
Sure. So I'm not sure how many of you are familiar with the match process of residency, but it's quite complex algorithm and it's far from perfect. There's a lot of complexities that come with it. It's not as simple as interviewing for a position and being offered a position. It's a lot about ranking programs that you like and not ranking programs if you're concerned that maybe you won't match there. And so, yes, spots are down across everywhere, not just in the Coachella Valley.
Well, I mean, look at the other surrounding programs though. Sacramento filled, Northbridge filled, West Covina filled. So, I mean, I looked at all the data, keep scrolling up. San Diego filled. Contra Costa filled 13 spots. Ventura, 8 out of 8. So I'm pointing this out because that's my job on the board. This is one area that I have experience in that the other board members don't. And I feel it's really important to express what I'm observing here before we go forward. And it's not a no, it's a, is it necessary to do it right now? Do we need to just say, hey, let's revisit this and see if things are changing in the valley that we can help with as a board? That's our job. We all know we need physicians and providers, but if we're not doing this the right way, we're not going to get the result that the community needs and the board is trying to invest in. Because look at the rest of the numbers all throughout. I don't think any other family medicine spot didn't fill. So I just have a lot of concern about that. And I brought that up well before this even match was even scheduled to happen. So I know you can't answer these questions. I can't either. I can just look at the data and kind of infer what this means.
Thank you. Do you have any additional comments, Director Luxon?
No.
Okay, Director Smith?
Yes, thank you. More of a question just based off of the sheet we were just looking at, because I also saw that and obviously didn't understand it as well as you would have, but looking at each of the areas, you know, it kind of appeared that the Coachella Valley was the only rural. Is that the only rural area on there? Because I guess my question is there an impact considering we are in a rural area that we're trying to address this issue, the shortage of physicians? So I do wonder, just from your standpoint, do you have any insight?
Yes, absolutely.
Especially for last year?
If you look at that list, a lot of these are very attractive areas for potential residents to go and live, you know, major metro areas, things like that. In general, it's always harder to recruit from rural areas because we want to find committed people that want to serve the underserved. And unfortunately, a lot of times that's hard. But we're looking to really, recruit the right kind of candidates that want to be in this area. And so that way we can grow community responsive physicians that are familiar with the community. And then they stay here. So we're not just hiring physicians, we're essentially growing them. I understand, the match data, it's hard, but like you mentioned, in rural areas, I know program directors in a lot of different areas in the country, and with rural, a lot of times they do go what we call unmatched, which means they have open spots. And they will go through a process called the SOAP, which again is highly complex and it involves a lot of phone calls, but you get good candidates even from a SOAP process sometimes. And I think in the end, we need to look at how do the residents come out when they finish there? And do they eventually end up filling? Even if they don't fill in the match, do they still fill in the end? And do their residents come out well-trained, and do they stay in the area?
And one final note on that is that there are programs that choose not to utilize the match to find the residents. They select to use a process outside of the match. And that is a strategic decision. If you have a good pipeline, if you build affiliations with medical schools, if you create that undergraduate medical education to graduate medical education continue, you can go outside of the match and fill your spots.
Just to add on to that, can you provide examples of that? I'm really not familiar with that. I mean, everybody I know that's a physician has gone through the match, and that's the traditional way. I know the SOAP process is more of the outside the match process when you don't match. But I like that. And the second thing too is I would say, look at the historical data out here. Yes, we're a rural area, but we have filled up until that point. I do have concerns about how it's progressing now. If you look at the history and where we are now, why aren't we filling those spots now? And we filled them previously. We haven't moved locations. We haven't become less rural. So, you have to look at all of that and say, is this really going after our mission of amplifying? Is there anything here to amplify yet? Or do we really need to go back and say, do we need to build something that can be amplified? And that's my point. I think we really need to think about where we fit into that process. Are we building or are we amplifying? I think right now, we're not amplifying anything because the numbers are not there across the board at these two programs that are big and well-known infrastructures. They're known in the match already. So
Thank you. Any other?
I just wanted a response about what programs don't go through these.
That was sort of my question in terms of going outside the match and recruiting physicians that don't apply or are not in the program. For instance, I made a friend with a woman who was trained in India in family practice, and there was some kind of exam that you take in order to qualify to be a family practice resident in this country. And she's not in the match. She asked me if I knew if there was any openings at Desert Regional or somewhere like that. And it appears to be a very brilliant woman. So is that what you're talking about?
Yes, there are programs that find residents outside of the match. There is one not too far away from here, is KPC Global. They're in Hamlet, and they choose to do it because, again, they're in a rural area, because it's difficult to recruit for rural areas. And this only speaks to the same issues that we're trying to solve, that we don't have enough physicians in the region. And unless we build the infrastructure to grow them here, we're never going to fill the gaps that we have in our communities.
So for me, this item is more than a grant. Yes, but we still haven't opened for
Okay,
public comment.
Yeah,
Thank you.
what he's gonna say those.
Thank you for that note. So like I was saying, for me, this is more than a grant. It's a strategic investment in the future of healthcare access here in the Coachella Valley. We continue to face serious shortage of primary care providers, especially in areas like East Valley, communities like Mecca, North Shore, City of Coachella. This leads to delayed care, worsening chronic conditions, and unnecessary emergency room use. In my opinion, what makes this grant different is that it builds a solution from within. Instead of competing for a limited pool of physicians, it creates a local pipeline, training doctors here in our community where they are far more likely to stay and serve, as we've seen. And the impact would be almost immediately. By year 2, there would be 8 resident
16.
positions,
16.
and then by year 3, 16. And so, I mean, that's all expanding access, reducing wait times, and improving continuity of care. This grant application strongly aligns with our strategic priorities of this, our 5-year strategic plan that we're currently in. And I see it as, let's end it right with being able to invest in this program. Okay, so again, like I was saying, it aligns with our strategic priorities, expanding the primary care workforce, increasing services in high-need areas, and advancing health equity. Just as important, our funding is leveraged by, it would be federal and state investments are already in place, and our dollars help bring the larger effort to life. At its core, this is about building long-term capacity, not just funding short-term services. This is how I see it. So for those reasons, I'd be supporting this grant, and I'll second the motion. I'll go ahead and open up for public comment at this moment.
Some of the hands were up online, but I suppose since you're in person, go ahead, Mike.
Yeah, updating on Desert Regional as the Desert Regional CEO, we can see that we did not match any in the family medicine program. And in the match and the SOAP process, there aren't any guarantees. It is very, as it was mentioned, it's a complicated process of how that goes. And whether you match or not can determine how the resident candidates rank the programs, as well as how the programs rank the candidates after the interviews. And based on that is how it lines up whether you get anybody. So we did not, fortunately, did not get anybody through the match process. We did fill our slots through the SOAP process afterwards. That's also not a guarantee, but we were able to do that this year. So just for everybody's awareness. But there is definitely with these programs, and as we've seen it in multiple places with FM, the candidates pool was a little bit different this year than what we've seen.
Thank you for that input.
And the SOAP process is a very limited assignment.
It is, yeah.
The scramble.
You-
It's a- we call it scramble
Yeah.
for a reason.
Yeah.
Thank you for those comments. Any other comments, public comments?
Yes, oh, I'm sorry, Dr. Sullivan, did you?
Yes, I actually want to follow up on what you said. Everything we're talking about today is true, but it's also true that we're short dentists, physical therapists, speech language pathologists. So we have a larger issue than just family medicine. So I've been like you thinking, what can we do differently? I mean, if we look at it differently. And we have an issue of certain terms of health too. So we have shelter issues, food insecurity, healthcare, and workforce development. I'm saying that it might be good in the strategic plan to look at it as what is the blockchain of outcome from high school graduation to becoming a physician, a dentist, a physical therapist, a surveyor. There's lots of professions that we're short of in the Coachella Valley. So we did something that, I presented something I'll be presenting to the CEO in about a month, but I'm actually with you. Why don't we give them the grant, but also say, there's a need to work with the Desert Health District to look at a different solution. Because the whole valley is a mess.
But I would argue
Thank you.
through the FQ system is that they have integrated care for dental, for psychiatric,
They
for.
may say they do,
And so
but
I
that
think-
implementation's not happening.
I would respectfully disagree.
Well, I
don't
think
wanna
so.
argue, but-
Actually,
Especially as one who works for
Well,
the
you-
county and the
you
health
can
and
argue
wellness
with me,
system.
it's okay, I like arguing.
And I shouldn't be arguing with you on public comments.
But I look at the data from a population health perspective,
So do I.
and it's totally different.
So do I.
Well, then how come the people? up in-
I can't argue with you in public comment. I'm
Okay,
sorry.
thank you. Yeah, thank you for those comments. Any other public comments?
We do,
Go ahead.
Carmela, please. You have 3 minutes.
Okay, I just want. Can you hear me? Because I just went blank.
Yes, we can hear you.
Okay, I just wanted to make a few comments about the match. The match this year was a unique situation. Most program specialties did not match across the board. A lot of what happened with the match has a lot to do with the politics. Many programs were worried about IMGs being able to come on board and start in July, therefore creating a situation where many programs in all specialties did not fill this match. It was a unique match in the sense that a lot of specialties had concerns and did not fill. The other thing I will say is recruitment isn't a one-day interview and you're done. Recruitment really is ongoing and developing relationships. And the key to doing good recruitment and keeping in mind what you're recruiting for. It's very different to recruit for a large hospital versus in a community-based setting, in an underserved setting, in a rural setting. Those are all different environments, and there are different physicians that want to work in each of those different types of environments. And so when you establish a recruiting process that really focuses on the type of physician that you want to end up retaining, you actually have a much better retention rate, which if you're bringing people in, that's the ultimate goal, is to keep them in place. So recruitment is, there's a lot that goes into it, and part of it is developing those long-term recruitment strategies. The other thing that is happening right now nationally is there is a huge influx of what's called COMS, Colleges of Medicine. These are DO programs that are being developed, the medical schools across the country. And DO physicians tend to move into underserved rural areas more than MD students. And there's a lot of research to support that. So that is another thing that just provides for the recruitment in the future in the next 2 to 3 years. May not be the same as it is today. So making decisions about a program based on 1 year's recruitment statistics it isn't a good decision.
Thank you. Director Luxon, you have, excuse me.
I just had a question.
A question of our public comment?
I had a question for the comment that was made that stated a fact that the specialties had trouble matching. I was just curious what specialties that was, because that was stated on the record now. Because I have the data in front of me and I don't see any specialized programs that have significant unfilled positions. So I'm just curious which specialties we're referring to, Carmela's referring to. Otherwise, we need to correct the public record.
I mean, but if it's public comment, we don't get to say what they.
Well, then I'll correct the public record for you. So I'll take this time to do that. Neurosurgery, 0 open spots. Cardiac surgery, 0 open spots. Vascular surgery, 0 open spots. Radiation oncology, 0 open spots.
Can you look at emergency medicine?
Plastic surgery, you said specialties, that's considered primary care. I just want to be very specific because the public is uneducated on this for the most part. And so I want to make sure.
Then you can look at internal medicine.
Again, that's primary care. You said specialty. Emergency medicine matched 95.6%. I wouldn't say that's a significant problem.
Actually.
I don't, we don't have to talk about it now. I'm just correcting it for the public record so that I can state that the specialties were matched.
On to the next public comment. Thank you, Director Luxon, and thank you, Carmela. Dr. Wu, you have 3 minutes.
Hi, esteemed members. Thank you for a chance to make a public comment. We've come to this point of making a decision, and it's been a wonderful time working and interacting with everyone. I do want to make a comment regarding behavioral health and the F2HCs and intercare. We actually, on our KPIs and our HADA scores, actually score well above the 90th percentile, and we are unusually high on that with our depression screening and depression treatment. We made a significant investment in that particular area of behavioral health and psychiatric services. And we've been able to spread and leverage our ability to provide those services across the counties, the 2 counties. The big question is, overall, when you look at this for both the residency programs and family medicine and OB, do we wait for this? And I think the question, the way in which the question has to be answered is, yes, we should wait for this, and the waiting time was actually 4 years ago. Because here's the visual and the honest geographic visual that I will give everyone. Think to the left of you, Emmett. Emmett shut down its labor and delivery. Palo Verde, Blythe, they shut down their labor and delivery. Then ECRMC shut down their labor and delivery. This is a triangle that surrounds the Coachella Valley. Your institutions, JFK, Eisenhower, and Desert Regional, are at serious risk. But what I can tell you is that for each of those locations, Hemet, Blythe, and El Centro, InterCare is there. We are already there, actively seeing the patients and directing the traffic for high-risk prenatal care and these family medicine patients, and distributing them appropriately to different institutions so that we do not have a backlog or a dangerous situation for any of the hospitals. It is this metering effect that only InterCare can provide. And that is what is unique to what we are proposing. And so that is what I would leave this board with. This is a once in a lifetime opportunity for us to be able to protect high-risk obstetrics so that our women do not deliver on the freeways trying to drive all the way over into the Coachella Valley. And we have experience doing this. We have the experience of fixing the problem for Imperial Valley. We did it when ECRMC shut down. We were the organization that took care of this problem. And we need the ability to recruit new talent. Our chance and our ability to fix this problem was actually 4 years ago. And we are facing a much more serious problem now that we have several of our colleagues that are about to retire within this year or next year. And we are already having difficulty with pioneers being able to populate.
Doctor, your time is up. We thank you for your comments.
Thank you.
Any other public comment?
I don't think so. Chris,
Yes, Chris, we're checking, making sure that we don't have any additional public comments. Yes, go ahead.
Yeah, I was, and maybe it's a topic for after, but I was just kind of more curious if if this match process doesn't work, then where did the residents come from that go through the SOAP process? Are they the same ones that would have been looking through the regular match, but then they come through the SOAP afterwards because they didn't see the alignment during the regular match process?
Excuse me, so was that a question for one of the directors, or were you expecting an answer from a member of the public, or just in general?
Well, I was asking in general. I mean, if Mike Toro or that's just a general question.
They also been through it, want to answer it?
Mike is answering.
I was nodding yes, but yeah, that's essentially how it works. If you don't match, then you have the chance to it's either called the SOAP or the scramble to align with any program that didn't match. Yes. Thank you.
Donna, can staff make a comment?
Yes.
I just wanted to point out in the staff report in the third paragraph that, this is going to be the region's first teaching health center in the Coachella Valley. So, this is groundbreaking. And that, we've been going through the strategic planning, and I'm really excited that we're going to be maybe going from just a regular grant making organization to a health system amplifier. And this kind of builds right in there, and the district can be taking the leading edge on this and helping, first QHC in the Coachella Valley to be able to do this. And we've got a lot of things in place with the deliverables, so it's going to be a contingency. So it's It's gonna be a tight, but a good process in evaluation.
Thank you for pointing that out and for those comments, and for reassuring the board on that. So seeing no other public comments, we have a motion, a second. Can we go ahead and get a roll call vote, please?
Director Smith,
Yes.
Director Rogers,
Yes.
Director Logston,
Donna, thank you for your comments. It helps to hear that from staff, it's a lot of conversation, so it's very positive to hear the staff supporting it, so I really do appreciate that. I'm gonna vote yes on that.
Vice President Rodriguez.
Yes.
President Barras.
Yes, thank you. Motion passes.
I'll go get a.
Yeah, okay, thank you, Alejandro. Just a reminder, this is not a break. We're gonna continue with this business. So our next item, we'll wait for it. Give him a minute.
Thank you.
Right there, that will begin to quick good stuff.
Let him get back to work, I think. So here's the match data. It's last one, I just said like, yeah. You can see this. And see it a lot. There. Let's see.
Oh, thank you. So we're gonna go ahead and continue. We'll wait for the rest of the boards to review. So we'll somebody over here. So next item is G.
My card.
I want to remind the board that we are in the middle of a meeting, so maybe we keep conversations to after the meeting. Okay, so the next item is G for grant number 1564 Hanson House Project Hope.
Yes, this is another one, the grant that has been through the program committee, for $103,155 to support a case manager at Hanson House. If nobody is familiar with Hanson House, he's on the campus of Desert Regional Medical Center. Developed and founded, and I think he was partly co-funded by the Desert Healthcare Foundation. How many years ago, it was founded by Dr. Frank Erkely, trauma surgeon. This is a wonderful place for people that can sleep while their loved ones are in trauma, under trauma care. And this is going to be funding a dedicated case manager that helps with providing one-on-one family-centered support from the intake of the families to through post-hospital transition.
Thank you. Do we have anybody from the organization?
Yvonne is on the. She is. Yeah, Yvonne Morano, she's the executive director.
Okay, Yvonne. Yvonne, can you hear us?
Oh, she has to unmute herself. Oh, there we go.
Can you hear me now?
There you go.
Yes.
Yes.
Hi, everyone. I apologize. First, I want to thank everyone and good afternoon. I just wanted to briefly share just about Hanson House. For those who don't know who we are are on campus at the Desert Region O next to the Cancer Center. We've been there for almost 23 years now. We are seeing a growing need beyond our lodging, families navigating care at Desert Region O and the Comprehensive Cancer Center need. guidance with helping with access to mental health support and access to critical research during and after treatment. A non-clinical case manager will help us meet this need and ensure families are supported every step of the way. Your funding will help us continue moving our mission forward as the only home away from home in the Coachella Valley. Thank you for your partnership and support.
Thank you. Any board member comments, questions?
I have a question. So right now they don't have one. This is a new position, correct? So.
Correct.
So financial sustainability, Donna?
Yes.
Go ahead, Yvonne, you can answer that. Financial sustainability for the position once the grant ends?
Yes.
Yes.
Can you hear me?
Yeah.
I'm sorry. It's really choppy.
Can you expound a little bit more on the sustainability of the position once our grant ends?
Yvonne, did we lose her?
Can you guys hear me? I apologize.
We can hear you now.
Okay, I apologize. I had to move around. Yes, sustainability for Hanson House once the grant ends. We will continue to work with our partners throughout Coachella Valley as well as fundraising and continuing to monitor all the grants that have an opportunity to continue this mission. One thing about Hanson House that we're seeing is the growing need of the families that not only do we have a growing wait list, but also the families that are there navigating through financial disparities when it comes down to transportation income. So a lot of the grants that we're looking at now further out is to continue to support that for the long term.
Thank you. Any other follow-up question or comments, concerns?
I would move approval of grant.
Second.
Public comment? No public comment. We do have one.
Oh, we did.
Oh, I just wanted to share that Yvonne is currently a student in our UCR Professional Certificate in Nonprofit Management. So she's going through a 35-week certification program in nonprofit management, which includes governance and also working on fundraising skills and grant writing. So her skill set is definitely expanding through that program. And also she is a recipient of a current MPO-centric grant that we've paired her with one of our MPO-centric consultants that she's working on some board work with. So I just wanted to share that Yvonne is certainly putting a lot of work into strengthening her board, strengthening her organization, which I think will lend itself to being more sustainable.
Thank you for those comments. Any other public comments? Comment from Nanda.
Yeah, I just wanted to lend support and talk about a personal testimonial. My nephew was there at Hanson House for about a week when he was diagnosed as type 1 diabetic, got into the hospital. He was a 14 level A1C, and the staff there was just phenomenal. I have a personal friend, also Karina Vega, who many of us know, whose son was there for a couple of weeks now, and now he has been transferred out to Loma Linda University because of the seriousness of his injury. So a lot of support from the community because of the great work that Hanson House does in keeping families close together. Karina mentioned a couple of times that she would imagine driving back and forth to Coachella, to Palm Springs, but she said it was just a couple 100 feet away that she was able to go reset, recharge, and then go back to be by the bedside of her son. So a greatly needed service in the community that is benefiting our local families.
Thank you. Yes.
I'm speaking for Chaplain Mark because I know he debriefs a lot after he comes back from his time as a chaplain at Desert Regional, and he's told me many times he's taken family members over to Hanson House and what a big assistant they are in terms of not only helping the family members, but giving comfort to the patients to know that their family's nearby.
Thank you.
Any other public comments? Other comments from the board? No, we're ready for a roll call vote.
Director Smith? Yes. Director Rogers?
Yes.
Director Longston?
Yes.
Secretary Delara? Yes. Vice President Rodriguez?
Yes.
President Barack?
Yes, thank you. Next item is G5, grant number 1565, the LGBTQ Community Center of the Desert, the Center LGBTQ plus affirming mental and behavioral health care.
Right, this, again, in your packet, program committee recommend approval. Funding will support, 2 Spanish speaking therapists so they can expand, access to underserved areas and also they're gonna be training clinicians. So, kind of 2 birds with 1 stone, but not only culturally competent training, but also, in providing services, but then building the workforce, especially most needed in the behavioral health world. And Mike Thompson, who is the CEO, is here. Welcome.
It's a fabulous party Saturday.
Oh. Out of red. And I'll just skirt this. But anyway, good evening. I'm Mike Thompson. I'm the CEO of the LGBTQ Community Center of the Desert. I want to thank staff for your work and support of this request and the program committee as well. I'd like to address, I've got Dr. Jill Hingston, who is joining us virtually, who would like to make comment following me. And Dr. Hingston can speak to the impact of the grant. I'd like to speak specifically to the sustainability question that was asked about the grant prior to ours. The center, when I started in my role in 2014, was a $700,000 a year budget. We're now at $5 million. We have 35 staff between our center on Palm Canyon, just across the street from your offices, our community food bank on Alejo, and then the center at Coachella in the old city hall in Coachella. And so the entirety of our program has been built on individual philanthropy. So we're confident that should we be awarded this grant, that over the course of the grant period, we could build the donor base to be able to sustain this, because we understand that in order for us to effectively do our job in making sure that members of our community, especially those and their families living in the eastern part of the Coachella Valley, have competent, affirming behavioral health support, it's going to be vital that we have Spanish-speaking therapists, which has not been easy. We have identified 2 currently that we are ready to employ and put to work in the East Valley, and we appreciate your consideration of this grant. And if we could, if Dr. Hingston could make comment.
Not sure if it.
Behavioral health at the center.
Oh, thank you.
Yeah.
Dr. Hingston?
Yes, thank you. Good afternoon or early evening. Thank you, Mike. Yes, this grant would help us continue to serve our LGBT community here in the desert, who, as we know, is at higher risk of mental health issues, especially in the world we are currently navigating. Our Spanish-speaking therapists, 2 of them, we much better reach into the East Valley, and they would provide, as Mike said, LGBTQ competent and affirming mental health services to folks who need the specialty care and who have been asking for it from us. And I think one of the big benefits of this grant would also help us to maintain our, what I will say is quite a great clinical training site for students and associate level therapists. The benefit of that is that they are trained in affirming care for specifically our community, and then are able to go out into the local community once they're licensed and do no further harm to LGBT folks, which has happened historically. So I want to thank you for your consideration regarding this grant, and we will continue our good work.
Thank you. Or any comments, questions? Yes, Director Rogers.
I somehow have read that there's a high rate of suicide amongst young teenage LGBTQ children. Does your program address that?
Yes, absolutely we do. And that is true. And especially what we're seeing today with trans youth. But yes, we do. And all of our clinicians are trained in everything regarding safety plans and suicidality and how to deal with those issues. And it isn't just children, it's our whole community.
I've read that there's a higher number of children.
There are.
Yes, yes, because being marginalized and being young and being a young queer person has a lot of different layers of stigma and internalized self-loathing, hatred, all of the above, because all the messages that we get as gay or trans people by society are not necessarily healthy.
Any other board member?
Yeah, I
questions?
want to echo some comments I made in the program committee, and it gets to the point of the environment we're in right now. And two of the most marginalized populations right now are the LGBTQ community, primarily the trans community, and then those of Latino descent. And so to me, this is a great way for Mike and his team to fulfill some of the damage that's already been done, especially as we see even more cuts and issues with Medicaid and Medi-Cal. I just think this is a really beneficial grant, especially to Donna's point, you're really getting kind of a double whammy with this as well.
Thank you, Director Smith.
Question, well, comment. I think the work that you guys do is exceptional. And I do wonder, just in listening to what you said and reading the report, as far as these new positions or the positions you have, you talked about your office in Palm Springs and you talked about expanding services in the East Valley. What about Desert Hot Springs? What about Cathedral City and these other areas that also have, that are underserved?
Yeah, we are just finalizing what will be about a 300-page quality of life study that we ran last fall across the valleys. It's a statistically significant study with 1,440 respondents all the way from Desert Hot Springs to the far parts of the Eastern Valley. And so that information will drive the decisions of our programming and strategy going forward. So while we are starting with the addition of Spanish-speaking therapists, we know that there are a lot of plans forward from what we will have in this study so that we further expand this program. Behavioral health is our stake in the ground. In fact, we have added a part-time clinician who is also a certified community health worker to do all of our intake at our community food bank. Last week, we had 510 households through that food bank, 19 new client intakes. Our community health worker who's trained in behavioral health did every single one of those intakes to make sure that if someone has a behavioral health need, that we address that as well as their food insecurity. So that's our stake in the ground, is this behavioral health program.
How many people did you say responded to your?
1,440. So
How did you get that many people to respond?
we worked our backside off because we knew that we knew we would be West Valley heavy. So we had to be really concentrated to make sure that we got responses across the valley for it to truly be representative of LGBTQ people's lived experience, because we didn't want to weight the work toward West Valley.
Thank you.
Thank you. Any other comments, questions? If not, I'll entertain a motion.
Can I just make one little comment?
Yes.
They also have this wonderful canine therapist there too. Her name's Tosh.
Of course not. I didn't know that.
Beautiful. I see her. She lives on the corner from me, but
It's also found on our website, just alongside this.
Okay. Do we have a?
I'll move to accept it.
Do we have a motion?
So first, second, public comment?
no public comments.
Alrighty, roll call, please.
Director Smith?
Yes.
Director Rogers?
Yes.
Director Locke?
Yes.
Secretary Delara? Yes. Vice President Rodriguez?
Yes.
President Barraza?
Yes. Thank you. Next item is G6, grant number 1569, Galilee Center Bridge to Health.
This was a grant that was brought forward to the program committee. Galilee Center is asking for $185,337 to continue with their Bridge to Health program, which is utilizing medical and behavioral health services for the underserved and the migrant families that they serve in the area. We have a great partnership with them, especially through our mobile unit. We do have just Galilee, if anybody has any questions or say. But just thank you. Program committee recommend.
Oh, good afternoon. My name is Lipa Torres Hilario. I'm the Director of Operations at Galilee Center. And I just want to say thank you very much. Getting the social determinants of health is a huge problem, and but building collaborations and partnerships with you, even if we begin to scratch the surface, will be very beneficial to the community, the low-income community of the entire valley, actually.
My name is Martha Olvera. I'm the Assistant Director of Operations, and I have worked alongside the mobile unit at our emergency shelter. And we've also had clinics at our center, and our community has been coming to all of our events. Has grown, especially because of the trust of both, I believe, both Desert Healthcare District and Galilee Center has a trust within the community. And we hope that these medical clinics and all the different services that we provide, they will be able to come to us and be able to get the support that they need. We know that our community is underserved, and we are there for that. Thank you.
Thank you. Board member comments, questions? Seeing none, I'll entertain a motion.
I'll move approval again.
Okay, public comment?
No public comments.
All right, thank you. Roll call, please.
Director Smith?
Yes.
Director Rogers?
Yes.
Director Locksmith?
Yes.
Secretary Delara?
Yes.
Vice President Rodriguez?
Yes.
President Barraza?
Yes.
I would like to make a comment now that it's moved forward. I do want to mention that I did notice that they are weak. One of the weaknesses in their application, or not weaknesses, but it was noted that their strategic plan was outdated by 2016. So hopefully they can get a new strategic plan. Okay, 10-year anniversary. Okay.
We know somebody who might be able to help.
Yeah. I would also say they've been a little busy to work on strategic.
We already voted on that, right? Next.
Yes.
Okay. So next item, G7. Okay, Director Smith will be recusing herself from this item. G7, grant number 1571, Jewish Family Services of the Desert, increasing current and future access to mental health services for Coachella Valley residents.
Okay, and this was the last one that was brought forward to the program committee, which have moved approval for $143,750 to continue with their great behavioral health and counseling services. The funding was going to be basically putting partial salaries of 5 positions. And I believe Craig Johnson is on the people. There he is. If anybody has any questions. Craig, you want to say anything?
Yes, please. Thank you. Just briefly, I'd like to thank the district staff and certainly the foundation's board of directors for even considering our request. As I hope we made clear in the application, this program serves to increase the current availability of no-cost mental health services while increasing the area's future clinical bandwidth. The program offers free counseling services to our 16 partnering agencies, so the receipt of grant support is crucial to the program's continued success, and I'm certainly happy to answer any questions you may have. Thank you.
Thank you. Any board member questions, comments?
I have a question. Craig, in the application, it mentions that there was a little bit of, it was unclear about the reimbursement rates. That even though it wasn't a concern because anything that would be reimbursable, I guess would be in addition to funding that you already have in place. But can you elaborate a little bit about why it is unclear about the reimbursement rates?
Yeah, actually, thank you very much for the question, Director Lara. We've received clarification, which is favorable clarification from IEHP primarily, is that if we are able to get our interns reimbursed for services provided to IEHP clients, it would be at the full rate, at the rate for a licensed therapist. So we are currently in the process of credentialing our therapists, our interns rather, with IEHP, and then hope to, in addition to serving our partnering agencies, filling out their calendars with IEHP clients as well. So that was certainly good news for us, which then speaks to the sustainability of this program moving forward.
That's fantastic. The second thing that I want to just mention was I'm impressed with the fact that you're using interns to be able to address the shortage of licensed therapists. And now it seems like it's a win-win. So congratulations on working through that.
Thank you. Well, and I can't take full credit. We were actually sitting in on one of these meetings a couple years ago now, and it was the Latino Commission program, and they were talking about their intern program, and I turned to my colleague, I'm like, shoot, we could do that too. And so we borrowed a good idea, and it's really paid off dividends, certainly for our partnering agencies, and we've had 2 interns graduate, if you will, through the program, and they're seeking their credentialing certification currently, and at least one has pledged to come back to the agency. So again, whether they come back to JFS and increase our clinical bandwidth, or at the very least serve the Coachella Valley residents, that's the ultimate goal of this program.
Great. Thank you. Any other board member questions, comments? Seeing none, I'll entertain a motion.
I'll move approval.
Second.
Okay. Public comment?
No public comments.
All righty, then roll call.
Director Smith. Oh, excuse me.
Yes, herself.
Director Rogers.
Yes.
Director Lockston.
Yes.
Secretary Delara.
Yes.
Vice President Rodriguez.
Yes.
President Barraza.
Yes. Thank you. I want to check in with the board. We're at the almost 2-hour mark. Are we ready for our break or do we want to
Yeah.
continue? I heard it again. 5-minute break? We'll go ahead and take a 5-minute break and then we'll return at 6 p.m. to continue with our meeting. This is actually the kind and of meaningful community-driven progress we should be proud to advance together. With that said, our next item is G8. It's a grant budget increase. We'll go ahead and have staff give us an intro, and then I'm looking forward to having this conversation. All conversation. Take it away, Chris.
Thank you, President Barraza, and I appreciate that intro because that took a lot of the staff report patience. So appreciate that. And this is a reminder then that the 3.5 million then takes us from what was previously approved at the 8 million of grant budget, takes us over that about 67,000. So keeping in mind then that we have currently about $13 million of grant applications that came in prior to the March 1st deadline. There's some where staff is working through those to determine which ones probably would make sense to go forward with this year. But there still will be probably a few $1 million total. So I guess the communication or the discussion and possible action for the board to determine if you want to increase again, whatever amount, but potentially the $3 million to bring it back up to that level that was established, really intended with that January action. So that's for the board to consider, discuss, and then possible action to increase whatever number. But if you do go up 3 million, it would increase to 11 million for a grant budget for the year. It would put us over in our operating as a loss of about 3 million. That's all just informational. There's no influence from me with that. It's all information just so that the board is aware in their decision.
Thank you. I'll open up for board discussion. Director Rogers.
Can we go alphabetical?
My first name or last name?
I'm okay. That's why am I always sticking my hand up? Anyway, as I indicated, that we have quite a few million in reserve, so I don't see any reason why we can't fund the full 13,000. Is it? Did you say that we have in the pipeline?
13 million.
13 million. I mean, 13, almost 14 million that we have in the pipeline. Or our other fallback is that we can fund the grants as they come in, and even if they're over budget, we can still fund them. I mean, a budget is fluid. There's times when we funded programs that were not part of our priorities, or there's times that we've been over budget in the last 11.5 years that I've been on the board. So, I think that's up to the board, but I think it's important that we give all of our grantees a fair examination, evaluation, and know that they're all important in the community.
And I should clarify that of that 13 million, we are staff-wise reviewing those, doing some high-level due diligence work, and we'll be bringing those back to, say, program committee for further discussion and consideration on those. But some may be considered to postpone until next year, or they could all be done, however the board wants to choose.
And it's not against the law to go over the budget.
No.
Yes.
And then Director.
Donna, will we have the list of what's in the priorities by the next program committee? Okay. Is it essential that we allocate money tonight?
Not required tonight.
Just my thinking is, and I'm not making any kind of motion here, but it's like, I think it would be important for us to see the list of those that are going to qualify under the board's direction, under the priorities, and then have a better number. Because I'd rather not just allocate 3 million now and then find out that, oh, well, really 5 million would really help. So that's my thinking. So.
Any other comments, questions?
Yeah, I would echo that. I mean, we set a budget, again, we've been here just 2 months ago and expanded by 3 million. Now we're doing it, we're requesting to do it again. If this is how the board's going to operate going forward as we continue to receive money, I think the view from the public in a fiscal way is that they're just spending what they get. You know, I got $20 in my pocket, I'm gonna go spend it. There's something about setting a budget and sticking to it that I think as a publicly funded group is extremely important because Congress doesn't operate that way, you know, and we should say, hey, we're gonna show you how to functionally operate and set a budget and stick to it. If there's an emergency in the community that comes up, that's a different situation. So I agree with Greg that we should table this, rediscuss it once we see the rest. And I think these should come through the finance committee. We actually look at all the finances, look at the thing coming in, timing of it coming in. That's why we have a finance committee. And this really wasn't brought up to the finance committee as an approval, something that needed to be pushed out into this meeting. So I think we should utilize our groups and our different separation of powers and reviewing of these things before we bring something publicly up for additional spending. And I would also say that the fiscal year is up when, Eric?
June 30th?
Yeah, so is there something in there before June 30th that says you must do this now? Or should we just wait, get a budget approved by June 30th that expands all this and fund them when they come in? Because again, part of budgeting is expecting to have things that come up by the end of the fiscal year that you still want to fund. You don't fund everything in the first 3 months of your fiscal year and run out of money. I agree with you, Greg. Thank you.
I'm sorry. Just a procedural question, so basically we could table this until next month's board meeting, correct?
But we're aware of the situation.
Yeah, because this was just for discussion and possible action.
Okay.
So to give direction to come to the FNA and the program committee with more information on that 13 million, and then a future decision could be considered. We just wanted to bring it so that it's transparent, being communicated, but I think that's prudent to do.
I'll make a motion, but Denise, I want to let you go first.
Oh. Yeah, I would tend to agree, what the other directors said, and I guess just a question, because it says here, the value of the current grants on the March agenda includes, 3.5, okay. So if all of these grants are approved, which I think we approved all of them, okay.
Right.
Okay, so going into this already, we were going to be in excess. We were already exceeding the budget that we set
Yes.
prior to that coming here.
So we're a little over $8 million now that's been approved. So, but it does make sense to your point, in my opinion, to at least see what is coming out of the due diligence work on the backlog of the grant applications. And then that gives the board better opportunity to decide what they might want to do.
Can I ask just a follow-up on that? Are we granting the amount that the grantees are asking for, or are we making adjustments? Because it would seem to me that, you know, if we were going to be under budget, then somebody somewhere, you know, who has applied is getting less than what we budgeted, right? So are we typically, just as a matter of practice, we're just going with what was asked for in the application, or are we making adjustments based off the budget that has been previously?
Not based on the budget, but more based on what is practical in that grant. So the grants team will work with the applicant to determine the best approach, making sure that they're aligned with our strategic goals. And then those are the amounts that are brought to the board. Typically, they're maybe around the same amount, but that would be considered the full amount based on those discussions. Nothing has ever been done based on that we have a certain grant budget and that we may need to do haircuts on some of the grantees so that we can provide grants to everyone and not cut people out because, you know, we all of a sudden run out of money and we can't do anymore. But that may be something that is going to need to be considered at some point in the future.
Just real quick, that Intercare is a good example. Remember, they started with $5 million asks and it went through a process and it ended up just under $3 million.
Thank you. So I do
One
have.
more point.
Oh, good.
I don't think we're ever going to run out of money.
I don't think I said that, but
You said that we'll run out of money. I don't think we're going to run out of money, not with our reserves.
Director De Lara?
I meant the budget. If I said run out of money, I. Hope,
But I do think we will run out of money.
I think you can run out of money.
Okay, but maybe just not the next 2 months. But I hear both ideas of to raise the amount up to 13 million on excess, and the other one is let's stick to a budget. I see the value of both. I think that like Director Longston said, that the public will view us as not having priorities and not adhering to a certain number. And so I don't like being reactionary. I like being proactive. And I think that's why we said, almost a year ago that we were going to stick to a budget in anticipation of a strategic plan that we could take proactive approach. So that's one thing. And then I hear Director Rogers talking about that we need to spend some money because some of our partners are requesting the money now and the public is in need, and that we need to not ignore, not to avoid being able to help them because there's a big dollar amount in the bank account, and the visuals of that can actually make us look like we are not hearing our constituency. So those two things, I think we have to get in between those two to look at. I wish that there was actually a way, and I think this is what I'm asking staff, is to evaluate the asks and what you propose right now, Chris, to look at what is an amount that will be impactful, that will be practical, that you can bring back so that we can set a number and be able to be anticipating the strategic plan, because I really do think we need to address the systems change that we're looking to do with the strategic plan and not just be reacting to the real need, but still reactionary. So I do support the motion that you've made to bring this back after vetting it in the committees.
I do have a few questions. So we exceeded our grants budget by 67,583.
Correct.
Do we need to approve that? Adding that to our budget now?
I don't think it's necessary to do that now, because budgets are budgets and sometimes they go over.
Okay.
But I think it's very prudent to delay this, as Director Rodriguez has suggested, and then consider more next month when we start looking at the list of grants.
Thank you. I do agree with their comments as well. We're not accepting any more grant applications for this strategic plan fiscal year, which is good. So we know the numbers. So yes, I think it'll be easier for next month if we can get or we can bring it up to the committees, a projection of those numbers and how I also see it. I don't see it as being just reacting to the need because we've known all along that the need is there. I see it as an opportunity to invest in our communities, but I also understand, like, I get right, like where everybody's coming from. We're like, hey, let's respect our budget, or hey, budgets could be flexible, but hey, let's not just react to something. So like, I hear you all. So if we can get those numbers for like during our next month's committee, and so that we can take a look at what that looks like and then determine an amount that we feel comfortable investing within this year. And then we'll go from there. And I think this will also help us in the future, right? Because if we were able to invest at this capacity, were we maybe underinvesting previously, or is this going to be like our new norm? Because we're at what, 11 or 8?
Eight presently.
Mm-hmm. So I think that's just something for us to keep in mind as well. We do have a motion, a second. Any public comment?
Sorry, who was the second? I know.
Director De Lara.
Okay, thank you. To table the matter?
Table it till next board meeting with the caveat that staff comes to both the program and finance committee.
Can I have one more comment? In my experience, we have had emergency grant applications for, and I just want to say if there's some unforeseen circumstances that we may not know about, earthquake, to hurricanes, whatever, that the staff would be open to entertain emergency grant requests.
I believe, yeah, I mean, knock on wood, right? That it doesn't happen, but.
I think it would be the board that would be willing to be entertained.
That's-
Exactly. Staff would bring it to the board. I'm just saying that the staff wouldn't just similarly say you can't apply.
Thank you. So, public comment, I see a hand raised here. Go ahead. Yes.
I would just like to say, I went to graduate school in the 1990s. It was the decade of the brain. So then the whole Institutes of Health decided that that would be the topic. So after your strategic meeting, there might be, and I hope there will be, a discussion of chronic health management and of the county being well. And so maybe that's a program that the district health district promotes with the county supervisors that says, we're going to allocate $1 million towards the Be Well program. I'm just making it up, right? But that was the decade of the brain in the 1990s. We had the pandemic. No one used AI or Zoom before the pandemic. So we haven't talked at all about the effect that AI is going to have on healthcare. And I think that we should be thinking about social impact AI. How can we use technology to solve the problem of homelessness, living insecurity, access to healthcare, workforce development? And you can do it now. We couldn't do it before, but we could do it now. Maybe that's something that the board has to think about.
Thank you for those comments. Any other public comment?
Done.
Okay, roll call, please.
Director Smith,
Yes.
Director Rogers.
Yes.
Director Lobster,
Yes.
Secretary Delora.
Yes.
Vice President Rodriguez.
Yes.
President Raza.
Yes. Thank you. Okay, so now we're moving to reports. Page 1, Desert Regional Medical Center, CEO report. Michael, welcome.
Good evening.
Good evening.
The report is in your packet. We've had continued busy time with our community events, and I've updated our progress on some of our capital projects. I was going to update on the results of our match and scramble process. We talked a little bit about that with family medicine. We did completely match our surgery program, our emergency medicine program, our transitional program. We filled completely with a mixture of the match and the SOAP process. And our IM program, we filled 5 out of 6 spots, again, a mixture of both. It was a busy month in February, so I just included some of those numbers in the packet. We saw a lot of increase from January to February, and many of the counting numbers from our ER visits to admissions, the acuity of the patients. And this is all with it being a pretty unimpressive flu season this year. Our flu admits, when you look last year, so 24 and 25, that season, we ended with 238 admits over the course of that, 6 months, 61 COVID admits. This season, tracking through the end of February, our flu admits were down to 60 and only 30 COVID admits. So interesting dynamic between the volume increasing in February, but not really related to this seasonal illness in terms of flu. And if you ask what it was really a mixture of a lot of things. We talked about this last month a little bit, and just an interesting month, but I want to highlight that the team between our nurses throughout the whole hospital, ER, ICU, all the med-surg tele areas, as well as our physicians across those areas really rise and shine when the need is there to care for the needs of patients. We use our CDPH approved flex areas when we need to manage the surge. And I think the team really did a wonderful job. So shout out to them. And then the last piece I wanted to brag on, our stroke medical director, Dr. Hamed Fareed, and our stroke coordinator, Kendallin Zarevny. They got the honor to present at an international stroke conference in New Orleans. And they were formally recognized by the AHA, the American Heart Association, get with the guidelines with some distinct, the Gold Plus honor, targeted in stroke honor, Elite Plus, advanced therapy, target type 2 diabetes honor roll, these are the highest recognitions a stroke program can receive, and we're one of 22 in the state of California. So having that local in this community to care for not just the folks here immediately in the Coachella Valley, but the greater area where our patients come from, it's really an asset to this community. So with that, take any questions if there are any.
Any questions? Can you tell us a little bit more about the status on the seismic retrofit?
Seismic retrofit, so we've met the deadline. They actually pushed the deadline to submit the architectural drawings back to February 1 of this year. We met the previous deadline. We actually submitted it in mid-December. So the state is going through reviewing all of our plans. When I have more to report, I will, and ultimately they'll put some of this stuff online. But I think as I shared, we've got over 20 distinct buildings at the hospital, and every building required its own submission. Each submission has north of 10 documents, many pages. There's a massive project that went in by the architects. And as you can imagine, for the state to review all these plans, it's just going to take a lot of time. So they've started engaging in some of the response to us, asking some initial questions, which is all part of the process. And I think the biggest take home is we're on track to meet our deadlines. And as soon as we get stuff from the state, we'll continue to work through it.
Awesome. Will those updates, are they going to be, posted at HCI's website, or do they have?
Ultimately, HCI will post things on their
Are they
website,
so?
but where we are in the process now, because the plans that are submitted get questions, things will be changed. So nothing's going to be posted yet until things are actually finalized in the process.
Thank you. Any other questions? Alrighty, well, thank you for your report.
Thanks.
Up next, H2 Desert Regional Medical Center Governing Board, Director Rogers.
Yes, your report is in the packet. Any questions?
Alrighty, seeing none, we're gonna move on to H3 Desert Healthcare District CEO report. Chris?
Thank you, President Barraza. I would like to just make an informational item that is not on the agenda. I think I can do that, right? So it came to recent knowledge that Park, who does a lot of the data kind of work in our community, has communicated that they're in financial dire straits. And so I did meet, Donna and I met this afternoon with Jenna, and they definitely are in dire financial straits. And so just wanted to make that information available to the directors. We did talk with Jenna about some possibilities of reaching out for other possible supporters. Also invited Jenna to come to our workshop next week for strategic planning, because we do have a pillar that's specifically related to data, and to hear more discussion related to that, and see if there's maybe an avenue through that source. Some history with Hark, and Donna's much more familiar with this than I am. They were actually incubated with the foundation years and years back, and then they were spun off to essentially be on their own. So there's history with that. If you have any questions just from that preliminary information right now, but just wanted to bring that to your attention this evening.
Director Delar.
Okay, so I am glad that you met with Jenna, because as I said before, I do appreciate the fact that you're acknowledging that there is a need to support and to explore possibilities of being able to continue. I would hate for us to lose all the ground that we've gained in the last, was it like almost a decade, 2 decades, maybe?
20 years.
20 years ago that it was created, and the health and needs assessment that is done every year and was presented a few months ago. A lot of organizations look forward to that report being available and being able to use that data in their funding requests for other funders. So that is something that is very important to nonprofits. And And for us, I know we use it a lot as a tool as well. So I guess I'm just wondering, I know that you're working on it, you're meeting and that it all really falls incumbent on them. But I guess I just want to know whether there's some directive from the board on exploring different alternatives with them, because right now it seems like it's up to them to do it. But is there something that we could be more, possibly if there's some board support to actually be looking to enter into some kind of agreement to assess what are the things that are the most impactful and necessary, and if there's a way that the district could come back and bolster them up to ensure that there is a tomorrow for HARC. Because my understanding was that they're looking possibly at having to shut down.
Yeah, and it's unfortunate that in my opinion, that they've waited this long to sound the alarm. However, that's where they're at. And I know this can't be an action item tonight, but it's kind of more look for direction. I did ask today that they provide, because one of the things that they communicated is that they've lost quite a bit of business because of they're not federally funded, but they do work with organizations that receive federal funds that have been impacted by current administration's limitation on funding. And so they've had projects that were lined up that then had to be canceled because of the loss of those funds. And, so they're just not getting the work that they used to be able to support their operations. They currently are down to 6 employees and it's pretty dire. To me, the board could give direction even to come back, at our next meeting next week, if there's possibility that the board wants to consider doing some kind of operational support funding in that. My only concern for that is that, you do that for one, then you do that for other organizations that fall into that same situation. So I think it's a sensitive issue. Just want to present it and get direction from the board as to what you might consider you might want us to do.
And further, the meeting that we had, they have a cash flow problem right now. They have probably about $2 to $3 million in outstanding invoices that they're not getting paid. Even from the Kaiser and who was the other organization that sponsored their community monitor presentation, each one would be promised them 5,000. They haven't even seen that. So they've got quite a few invoices out there that they have not been paid. So they keep asking for that money, because they've done the work and they're not getting it. So if they can get that money in, then that would solve, not immediate problem, but it would help.
Yeah.
Director Lexon, you raise your hand.
Yeah, I think we have to be careful not to be soliciting somebody to come in and submit grants for us. Especially, none of us can do that. I think if they're not reaching out saying, hey, apply for a grant, then
they did after we said.
But we can't. You have to let them, just like we do with the general public, we have to be very careful that we're not taking favorites here and what that looks like in public. If they need help, they need to go through the process. I agree. We have a pillar for data support, which clearly is important. But what that appears out there is a back channel into the board, and they haven't been here. They haven't gone through the program committee. They haven't come here to talk about their need. Everybody else has to. So just because they have a back channel in doesn't mean we should prioritize them. I think it's important. We have to be careful how that's represented.
Director Lara?
I understand what you're saying and I can appreciate it. However, like I said, that the history here has been very unique, and that the healthcare district created this organization. It was embedded in the organization because of an unmet need. If they go away, many nonprofits are going to be negatively impacted. It is an issue of capacity building if you do not have the data that has started. So I'm not saying fund them, here's a blank check. I'm saying meet with them and see if there's because my understanding, Donna, that there is some funding that they have yet to receive, but those dollars keep decreasing over time. So it may have been $3 million, but as time passes by, those amounts decrease because they're not collecting. The work is not being done. So I don't know what the situation is now. We're doing this in a public forum. We're having a very public, transparent conversation. So I don't think there's any backdoor dealing here. What I'm asking for is
On the agenda.
some just awareness of the issue, and for staff to explore if there's a way that we could support the necessary functions, not to, again, to say, here we go, but it started off with something, it has grown. And if they really are looking at shutting their doors in 6 months' time, rather than wait until that 30-day window, to look at it now and see if there's some way that we could support it to, again, avoid having the negative impact that many nonprofits would face if they are not here anymore.
Director Luxon.
We have a policy to put things on the agenda before they're discussed in front of the board. We've had plenty of opportunities this whole time, and I'm surprised you're such a stickler for how we do things. This is not on the agenda anywhere, and it's making it to the board. So my comment about it being a back channel to the board isn't inappropriate. There's nothing on here that allowed us to discuss this. And so I think we just have to be careful how we do it. It has nothing to do with the organization. I would have said that about any of them, but it's not on the agenda. We're now having the last 15-minute discussion about this. And we're talking about maybe funding an organization that hasn't even gone through the process. We have to be careful how that looks.
Well, and I think and I'm counting on legal counsel to correct me if I'm wrong, but I think that I can bring that as a communication or information item. It's not an action item. We cannot do that at this meeting because it's not agenda. It is an urgent type of situation that want to make transparent and then look for direction and a consensus of direction, not just from one director, but a consensus of direction as to what you might like staff to do to proceed with this. I have asked Jenna to provide us, more information as to, what are the deals that they actually lost or why. Information that can be brought to the board in an emergency type of situation like this or an urgent situation, and get it on the agenda if we want to for next week's meeting. I've asked them Jenna to come to next Monday's meeting so that they can be part of that discussion on the data part. It's something that we're going to have to consider even with regard to staffing, et cetera, for the data pillar. So just so that we can discuss it, and even in process with SOAN and their team, and how that potentially, if it's something that could come back under the direction of the district or foundation.
Yeah, I don't think we're asking, it's just an informational item. It's just like if there was things come up in a report you can reference, and that's all it is. I don't think it's appropriate to be asking for any action or even consensus or direction because it isn't on the agenda. But you certainly have, his prerogative to bring it to your attention under his report, just like the CEO's previous report. There's things that he might bring up that just for informational purposes, but they're not action items.
Thank you. So hearing that, we will not be providing direction. It's just discussion and information. I will share my comments on it. I want to be supportive, not just to them, any organization in our community that needs our help. My preference would be not to tell them how we can help, but rather have any organization kind of figure it out or create a plan on their own. And if at any time they determine that they need our support, that they come with a plan to us instead of us working out a plan for them. Those are just my comments. Again, no direction, no consensus. I also do not believe that there's necessarily an urgency on our end to add it to our agenda because I welcome them, right? Because if that's what they do, but not necessarily to add this, or at least not this item or add an item on how we can help. If we want to include them within our agenda so that they can provide information and be part of the discussion within the data aspect of the workshop, I would welcome that. But thank you. Would you like to proceed with your other reports or?
Absolutely. Thank you. So information regarding the strategic planning workshops, we have 2 scheduled for next week, one on Monday, the other on Wednesday. The Monday workshop is at the Palm Springs office. The Wednesday workshop is at the, right here at the RAP office. And then we have, follow-up meetings in May that we'd be looking at financial sustainability and final implementation. So the next item on the agenda is just a quick update on the Palo Verde Healthcare District. Staff report is in your packet. They have been fed a lifeline, so to speak. The county has come through with not only providing an initial $1 million loan, but also a management agreement to operate the hospital emergency room for a 6-month period. They were successful in getting the IGT funding of about $8 to $9 million. And the Board of Supervisors today appointed 1 new director to their board. They're still down 1 director, but that director will go through the actual election process in November. The bankruptcy court is essentially just kind of letting things flow right now and to see how things progress. No questions on that. I'll move to next items. We have 2 letters of support that were provided. One was for Assembly Bill 2311, which was for healthcare district owned and operated hospitals, that it's a bill to be able to hire direct provider care or physician doctors directly into the hospital. So I did learn today that passed the Assembly Health Committee and is moving on. We also did a letter of support provided or asked for from our Senator Padilla here locally for permanent long-term forgiveness of distressed hospital loan program. We also have 2 items, like E and F, that are, and stop me along the way if you want to ask questions.
I have a question, Sue, but go ahead. You can start. No, please.
Okay, so it was brought to my attention, and I don't think we have a policy on this. And I'm not sure if we want to create one, but was told that as best practice, letters of support or a stance letters on policy or legislation should be signed by the board president. I don't think we have anything in writing like that, and I'm not sure if that's something that we would want to consider as a policy for our next policy committee meeting. Director Luxon, and then Director Smith.
No, I was just gonna ask, did this go through the legislative committee?
No, because they were time sensitive and
I see.
I don't think they were informed. I think they didn't make it.
Thank you.
Is this just a point of information and question for myself? When these letters get issued, is this viewed as the opinion of the board when the letters get issued?
Yes.
Did the board contribute to the letters?
I got to see the letters. I did have some comments, right? Like for one of them, I asked if there was any in opposition, and it's for AB 2311. So I just asked staff, is there, because the Association of Healthcare Districts had sent it our way. And so I just asked if there's any opposition. I just wanted to know, right? I wasn't informed when the letter was actually sent out. So I don't have further information
Something the
on that.
board wants to, I didn't cut you off, I'm sorry. Something that the board, if something's being issued on our behalf, do we want to approve that normally going forward? How do we usually handle that?
So I think that a lot of legislative committees do see these things, and we have seen others in the past and then bring it forward for recommendation or let the.
Like an action from the board to approve it?
Some of these are time sensitive, so they don't make it to the board. And I think that's also part of a policy that we can decide, right? Whatever the board desires, if it's, hey, we need to, a lot of other special districts, cities, they do have a policy where it's like, we can't sign anything or we won't actually support or any policy unless it was discussed by the board and discussed and approved by the board.
Well, I think that would be important because not to be super differentiating, but staff is one thing, the board is the other. We're the elected and this is an elected. If this is representing the general public's, our view that was elected by the general public, we should be approving anything that's getting mass
That was
distributed.
a differentiation, yeah, when someone brought it to my attention, I'm like, yeah, you're right.
Yeah, and it only came up now. I didn't really think, but it has nothing to do with what was written or whatever, just more or less the process at which our names are being attached to something without.
So I think, I mean, yes, I think that in absence of a policy, staff acted as they felt, but I do think that we do need to have a policy.
Probably
and
historical
the
precedent for
legislative-
what was done now, and I think going forward, maybe we.
Public comment?
I'll give it a shot.
Well, public comment on item H3. D.
So basically, and you started this in the legislative policy committee. If the organization develops a platform and because of your goals and objectives, you've got certain, sacred values of what you do. And then, for example, City of La Quinta, we have our legislative platform on things that, always keep things local, control land use, and support, just kind of the basics of the yeses and the nos of what the preference is of the board. So when these are approached by staff, even on short order, if they fall within that category, plus you've got Tish, who's your lobbyist, and they're guiding that process too, knowing what the priorities of the board are, then it allows the president, so I sign ours, and or the chair of the legislative committee. It gives you that quick guidance for that process because time-wise, you can't always bring things to the board. But the finished product usually gets sent out to everybody anyway. But if it stays within those realms, then it's not.
That's how we do it
Conversion.
at county.
County,
too.
the same thing, yeah.
Thank you.
Do you have an established policy? Something like that? I mean, I'm just asking if you've got language that we can.
We leverage over here and just get a view of it.
Particularly for cities and, this stuff comes up all the time. And so everybody says, well, wait a minute, how do we want to handle it? It was like you say, things happen very quickly on the legislative front and you need to take action. So you got to have some kind of parameters you can establish and so everybody feels comfortable that we can support it. I mean, the physician practice, that's been a historically, it's put it this way, controversial, challenging. It depends upon what side you're on, the employment physicians. And so, but it's something for district hospitals have supported this. I can tell you for a number of times they've somewhat been successful, but not, but only for specific hospitals, mostly rural hospitals that have difficulty recruiting doctors. So
It's a little bit of, just so the board knows, and this is it, but most places have foundation models. It's not very much far off from this, but hospitals in California can employ physicians, employ physician groups. Typically, there's a physician group associated with every hospital that's usually represented heavily by hospital administration in the management of that group. And physicians across the country can't own hospitals. We're all forbidden from owning any hospitals.
Fun fact. All right, thank you. So next item.
Okay, were we okay on both the letters then, or do we need to discuss the?
I mean, they're already issued, I think.
Let's move on.
They're both.
Okay, we'll talk about the next
On,
ones the
we-
next time they come up. Good.
We're getting them done timely for the legislative people, so. So item E and F are similar, they are election processes for, the first one is for the Riverside LAFCO. And so they have a ballot that typically we have our president will determine if they want to vote for somebody and send those back. This one is for April 23rd. This California Special Districts Association, item F, same thing, would be needing to go back by April 10th.
And on those items, I would welcome recommendations from the board. Who do we elect, especially for LAFCO, they've had their candidates to be. Look at that.
Does anybody want to run for a lock seat?
Well, that's.
They're already nominated, they're already nominated people.
Mhm.
You have to choose from those people.
They were selected for
nominated.
the Western
Oh.
region. Not necessarily something to discuss at this moment. The application is not due until April 23rd, by 5 p.m. And so, the bios and letters are in the packet. Do you have any input?
If at LAFCO, they let one special district representative serve on LAFCO. It's always a water district for somebody that, a large organization. And, frankly, the challenge a lot of times is you don't even know these people. So it's really hard to say, well, let's vote for so-and-so. Unless somebody has a real preference, generally speaking, you just sort of let it go. But you could, if somebody feels that there's somebody on the 5 member of the 6 people that are nominated that you think we'd like to vote for. Normally the applications, and sometimes I've even seen them come to the board and make a pitch. So.
Chris, did any staff member participate in their candidate forum? They had some sort of candidate forum last week.
Now, we have received, some support letters for some of the candidates that are in the packet.
They had a forum last Thursday, but I wasn't able to participate. I had
Yeah, I was.
another meeting. And then for the CSDA, that one is open for nominations, and that would be to represent Southern Network region. And so that's open for, I guess, nomination. I'm not sure. Something that we want to discuss at the moment. And it's open for board members and or general managers / CEOs. That would be representing our area, the state level. Not a decision that we have to make at the moment, but information under that we will be making a decision or submitting by the due.
But it will be needed to decide before next month's board meetings.
Do you have a recommendation? Do you have any thoughts on it?
Or which one?
I don't.
CSDA.
That's
I don't typically, that's by the board.
That's open, and on the packet, you'll see like the requirements. I believe that there's like 7 meetings that you'd be required to attend. They talk about some others, so.
Yeah, that's what I meant. Is anybody interested?
Not at the moment, so.
Everybody shaking their heads.
Passing.
But if anything changes, I don't think we have, again, a policy that says that we have to discuss or choose someone or vote on it
Correct.
right now, but it's informational and
Thank you.
that. Alrighty, so item G.
Okay, so this is information also for ACHD is hosting this week, Thursday and Friday, the 33rd annual Spring Health Professional Shortage Area Designation Workshop. We do have 3 of our staff that are attending that. We do have Megan, Donna, and myself that will be attending that workshop.
Any questions?
And the next item is the CEO engagements and district media visibility. The report is in the packet for your view and any comments or questions that you may have.
On the media, I know that we have a sponsorship with the UCAN report. Do you recall when that one's due? When is it annual?
It's a monthly deal. We renew it annually. But it's monthly, it's $500 we do for that. And it's really good. We've gotten some good comments about it, especially the kind of articles and that Will produces and information that's out there.
Thank you. Any board member questions, comments? Right. Now, legal?
Yeah, I just wanted to thank Andrea for bringing to my attention SB 852. It was passed last year and is effective for this year for 700 form filings. It's a, it's really a technical bill. The author said it was to fix a drafting error. But basically, the bill requires that public officials that, that handle investments or manage investments have to e-file your 700 forms, okay? And they include in that definition, the CEO and CFO. And basically, when they talk about managing investments, you know, we have an investment policy that comes to you and you make decisions on that. So this, like I said, is kind of a technical thing. So I would suggest just coordinate with Andrea to get the portal that you would file these in and make sure we have a copy on file here, just for the 700 forms.
With the FPPC.
Yeah, I meant the FPPC. That's where you e-file them.
If we're already doing it with the county and this is for the FPPs.
To add to that, the FPPC is extending their call time hours. So in case you have questions, do give them a call and submit them by April 1st. Director Delano, were you reaching?
Yes. Yeah.
I mean, we have to do both of them to FPPC and the county?
No, all you gotta do, I'm gonna have to do the county. Okay, we've been sending them to the county. But we always want to have one on file because we get public records requests and stuff. So it's, but these just go through a portal with the FPPC. And I think you can probably help them.
Yeah, I'll send you the email address.
And you're able to look at them, right? Once we file through NetFile, you're able to pull them up from there, right?
Oh, yes, but not with the FPPC. I'm not familiar with that.
I'd say they're connected.
Yeah,
Are connected.
there'll be somebody, or there's some website up there. I'm sure you can access.
Director Mark?
So is this the Form 700?
Yeah.
But the one that we just filed in January?
Our annual.
Well, you gotta file it. You may have already filed it. It's actually technically due on April 1st. Okay.
Okay.
It covers a year, January to
Right.
December.
All I would do is just,
One that I already filed?
I just file another one.
Okay.
Did it's just like I say, it's sort of a technical thing. The FPPC wants to basically be the clearinghouse for all this stuff.
Okay.
Which makes some sense because there was always some counties you wanted to file with the county and some wanted to file with the agency. So it was kind of confusing in some respects. So.
Thank you. Any other board member questions? No, next item.
Legal questions?
Yes.
Validation agreement?
Well, we're still, I mean, I don't want to talk about it in open session, but yeah, we're still working on it.
Did the judge make a decision?
Well, I'm not going to talk about it in open session. It's not.
Okay, and second question, can a healthcare district that leases a hospital employ physicians?
No,
Thank you.
that would be my opinion. You have to have it has to be a physician-based, or hospital-based physician. So because we can still support the concept. It's something that is very important and,
I'm just talking about employees.
Yes, but we technically, because we're not running a hospital, operating a hospital, we couldn't employ physicians to go to work at the hospital. That's Kennett's issue.
We could, if we were a designated institution with ACGME, we could employ residents.
Well, yeah, I mean, that's a whole different, I'm not prepared to answer that, okay? But there's a prohibition against the employment of physicians in California. This bill addresses that for healthcare districts that operate hospitals. It technically doesn't apply to Section P hospitals that lease their hospitals. That'd be the short answer.
Any other questions? No, we're gonna go ahead and move to the next item. Sponsorships. I want Codex Creation Committee, 7th Annual Mobius Conference.
Okay, this sponsorship missed our program committee meeting this month. And the event is coming up in April, so did want to bring that as an item to the board to vote on this evening. We have not provided any prior funding for this organization or for this project. The information is in the packet. They do have sponsorship levels from 50,000, 25,000, 15,000, and 7,500 for your consideration.
Is there a recommendation from staff? At what level?
I would say the beginning would be 7,500 to support a new organization.
Is it health related?
It's
About connecting people.
They do have a mental health and environmental health series that they'll be talking, speaker series as part of the conference.
They also do like environmental health,
They do
right?
environmental health, yeah, environmental justice.
Is our policy to review these in the program committee with recommendation? We add that or not? I don't remember.
It's typically the process in our sponsorship policy, but if we do have the ability that.
Just received late, or that why? Did they just not?
No,
meet the
it-
deadlines?
It was originally included in the program committee packet in February. But then we didn't have the committee meeting in February when we well, what happened is we didn't have the program committee, but then we brought all the sponsorships to the board meeting last month. This one missed getting into the board meeting packet in February, when all the others were approved. And so since and then it was overlooked with the program committee and reminded by the organization that they had requested these sponsorship requests. So there was some oversight internally. I'll take responsibility for that. But at this point, we're bringing it to the board tonight for your consideration.
I'll move approval for the 7,500 health session co-hosts.
I'll second.
Any, we'll open up for public comment.
No public comment.
Roll call, please.
Director Smith,
Yes.
Director Rogers,
Yes.
Director Loxton,
Yes.
Secretary Delara,
Yes.
Vice President Rodriguez.
Yes.
President Berrazan.
Yes, thank you. Next item is
And
I.
Can I just add that I hope that they will invite the HOSA students to this? If you could just mention that to them, maybe they already are. Thank you.
In the sponsors, and I guess sponsorship deck,
It
they
says that
do,
they're gonna be inviting over 300 students, hopefully it's the HOSA
they
students.
talked about the students and also the locations. I think some of us.
Thank
You're welcome. So next item, I2 Women Rising Festival de Rebozo.
Okay, so this was a sponsorship that the CEO providing funding for. It was $1,000 to support their video and photography services for the Women Rising Festival de Rebozo.
Any questions from the board? I know that the amount differs from what was presented to the program committee. I'm not sure if we need to amend the program committee meetings. The amount that was given was 1,500. And so that's what we have, that's what you presented during the program committee, and
We can change the minutes to
it was informational, it wasn't an
Right.
action item, it was informational, I just wanted to clarify. So the amount,
yeah, the actual amount that was given was $1,000. It was incorrect on the agenda for program committee as $1,500.
any questions? Next item, also informational, Desert Healthcare District sponsorship application. Oh,
So in the packet is the sponsorship application form that Gracie, our staff member, has put together. It's actually done through Foundin. So we're able to track the information. We'll have history from the sponsorships that we provide. And I think it's a good application form that's in line with our sponsorship policy, and will request and require all the information that's necessary, including budget, the estimated number of participants. And we also are asking how the grants or the sponsorships align with our mission and vision as part of our consideration. However, I know we do provide sponsorships that don't necessarily always align with our mission and vision. So I think it's a good application form that we'll use going forward.
Director Lawson?
One question on that. So we have to apply by May 31st for anything in December, is that correct? Is that how it's written?
Yeah, so what we're doing right now, any applications that are coming in with events.
Yeah.
Through June, we're processing those.
Okay.
Until we get to that new 6-month
Got
period.
it. So we'll have 2 deadlines each year.
Deadlines,
People in
so-
December will need to know what their budget is for that meeting.
So, yeah, any events July through December will need to be applied for by May.
I've never planned events before. Do you know 6 months in advance?
Yes.
Your costs are gonna be used?
Yes, you do.
Just making sure. We're not limiting people's ability to do that.
And I'm also looking at it very positive.
I love it, yeah.
And if it doesn't work.
No,
policy
I
can
love the
change
policy. I just wanna make sure that we're not.
But
yeah.
if it doesn't work on like the customer.
That's what I'm saying. That was my point. I just wanna make sure
For
that
the types of organizations we sponsor, you know.
they know, okay, that's good. I just.
Yeah, they're planning events year in advance.
So they know like speaker costs and all that. I mean, I don't ever do that. So I just was like, man, 6 months. I don't know, but I'm doing it 6 months.
Well, that's even like with our summit. I mean, typically, we're
Okay,
several
good.
months out.
You don't think it's gonna limit people from applying?
No, I think the only issue right now is more of the communication or the understanding. I mean, we're getting the communication out there, but there are gonna be those people that are gonna say, oh, I'm doing my event next month. I normally can get a sponsorship right now. And they're gonna have to start planning ahead a little bit.
Cool. We'll have to just inform our partner and people we find.
And we're doing that. We're getting more communication out and
We did send a notice out and.
We did, okay, yeah, because I know we sponsor a lot of people that are used to applying maybe a month or 2 before.
Exactly.
That we actually like, I think like the Jocelyn Center and those places, and it's like, hello, get on your.
Yeah.
Yeah.
And I think that's gonna be the pain right now.
Okay.
It's just getting, the sponsoring organization to plan.
That'll be a hard deadline, even if it's somebody we've supported before, hey, you didn't get it in, we're not making acceptance.
We're gonna try to hold to that if
I'm
the.
just saying we have to, we're
directors
gonna
say
pay it.
different. I think we need to hold to that new policy.
That's the only reason I brought it up, is it seems pretty tough to meet those for our current partners that we know we were gonna look to sponsor. I just wanna make sure that we can't, as a public entity, again, we have to stick to what we say. We can't pick one or the other. So we can't make acceptance, and I just wanna make sure we're aware. I'm so glad you wrote it, because we have a lot of sponsorships and I really like the way it's written. I just wanted to make sure the board was aware that 6 months is, you have to know 6 months that you want to request money from us.
And I think it's a respect thing too from the organizations, not just to submit a sponsorship request and expect the money for an event
Codex
next
just
month.
did that. We just approved one that we just got, months ago.
I mean, theirs was probably 2 months.
So that doesn't count.
Yeah,
So
correct.
to that point, we should be sending out notices before the hard deadlines. And then also, if we can get a report of those that did not apply within the time frame that we are rejecting, I think that would be good information for the board to consider. Thank you. Anything else? Any other questions? No? Okay, so the next 3.
Did you ask? Yeah, I just want to mention that one of our grantees, the center during the program committee, said that they already went through it and they provided really positive feedback on the great job that Gracie did putting it together. Just wanted to provide that for.
Thank you for that. It's great.
Thank you. The next 3 items are committee meetings. So J1 Legislative Policy Committee, information is on the agenda. Any questions? Concerns? Public comment?
No public comments.
Next item is J2 Program Committee. Any questions on those items on our agenda? Public comment?
No public comments.
Alrighty, next one is J3 Finance, Legal, Administration and Real Estate Committee. Director Luxon?
Got a couple updates. You see the meeting minutes, you can review those. There's the retirement plan, just updates, performance review. It's been a while since we've gone out for a bid for our comprehensive legal services that we provide here. And so it's come up a couple times. We tabled it last year, everything going on with the hospital sale, and we brought it up again this year. And so one of the things that came out of the finance committee was looking for direction from the board with regard to how we want to, and if we want to go out for a legal counsel RFP. So go out like we do with all the rest of our vendors or contractors, go out for an RFP. Yeah, so that's just sort of looking for direction from the board, how we want to handle it. Yeah.
Do we have a policy in terms of RFPs? Any other
So
RFP for
we have a
professional
board
services?
policy, yeah, OP 11 for procurement of purchase contracts and purchase services. And it states in there that legal services, audit services, investment services shall be reviewed and potentially bid every 5 years. Yes, we do have a policy.
And that's, let me just say, we've never done that. Okay, for legal services.
So we've been violating our.
We've always, I mean,
Potentially.
I've been doing this off and on for 30 years, so we've never gone through an RFP process. Now, you know, I think the
We did when
lawyer,
we brought you back on.
well, but that was because the board members wanted to get me. That was already, they had asked me to come back. That was in fairness. But my point is simply is that I think if you want to go through it, you know, a lawyer's a little bit like a CEO. You don't just go out with RFPs every 5 years to replace your CEO. That's something that you gotta, you know, that you should go through an evaluation process. So what I would suggest is if we want to do, you know, we could do an evaluation process, and then at the end of the conclusion of that evaluation process, if you think it's appropriate to go ahead and go out for legal services, that'd be the way to do it. But just to throw if you will, just to throw something out there to say, hey, what's available? I mean, it's like like I say, it's analogous to hiring a CEO. And I realize that's in the policy, but my suggestion is I like to work with the committee and let's come up with some kind of evaluation process and do that. Otherwise, you're gonna get a bunch of, very likely get all kinds of applications that are gonna take, it's like going through a process for a CEO. So that's my suggestion.
So my question to the board is, do we want to continue having this discussion? Do we want to table it, or do we actually want to provide direction at the moment? And I'd be welcome any.
I think we should table it. I'd like it to go back to the policy committee and just see their opinions on how we want to address this, because nothing in the policy forces us to make a decision. I do think having an evaluation of our legal counsel services as a public entity is important. And so maybe we perform some form of evaluation and decide as a group if we want to do that or if we want to wait. But this is just kind of a little marker that says, hey, every 5 years, we should review this, see where we are. Are we happy? Are we getting the services we need? And then we can say yes or no after the evaluation and then decide if we need to go out and get it. I just think it's part of following the policy that we set.
What I would suggest, and I know that falls under your committee that you chair, but what we can also do is like an ad hoc committee to actually work on this, and this is something that we want to do. Not necessarily something that we need to discuss right now or to assign members to an ad hoc committee, but would the board be open to going in that direction?
That's a great idea.
I think it's a great idea too.
Okay.
Mm-hmm. All right, shall you appoint an ad hoc committee now?
Are there any members of the board that would like to participate? I think that I would like to give the board a little bit more time to.
And I'd like to come up with an idea of how we wanted to go about this process, much like a CEO evaluation is extensive. We should figure out how we want to go about that process and then who wants to commit some time to look.
Larry and I raised our hand.
Well, I guess we'll send out an email and ask, right, like how we've done in the past for ad hoc committees where we ask or we just assign.
Oh, you can, as the board president, you can assign an ad hoc committee. Okay, I mean, you have the authority to do that. But yeah, you could ask, is there any interest in somebody who wants to be on that committee?
Please let me know. We won't form it right this moment, but we will. And then hopefully within the next couple of weeks.
That's great. Thank you, guys. And then the last piece, we do have an action item from the auditor committee. It's for the Desert Healthcare District and.
No, we already-
Yeah, that's right. We pulled it ahead.
Any final board member comments?
Sorry, I have a hard set, please.
Well, we're gonna, no, seeing none, meeting adjourned. And then we're gonna go ahead and move to our foundation meeting, no breaks, where we took a break.
You'll just be spent that, you know, for it. Are we gonna have a forum for the?
For the foundation?
Unfortunately.
So we're gonna go ahead and